And we will try to finish it today. And tomorrow we'll be moving towards other topics. So today, the first come first basis. First basis. Let me tell you, Dr. Nagma, she joined first, so she will be presenting first. And after that, Dr. Robina and Dr. Okay, and Dr. Nagma and Dr. Mona and Dr. Navish. And so, doctor, are you able to hear me?
Assalamu alaikum. Yes, Professor.
Okay, okay, doctor.
Yes, Dr. Ahmed, with Imran.
Okay, doctor. Okay, Dr. Nagma. So you are the first doctor to start a session. Remember, all the pediatric cases will be a proxy case brought by only mother or parent will be present, and they will be discussing the issue with you. So you have to take proper history and counsel them or give them a preliminary management plan. Like say, for example, if patient having the high grade fever, mother didn't brought because patient didn't sleep well whole night, so she kept it home. So always make sure whenever you're taking for pediatric history, so you have to ask about patient's birth, immunization, nutrition, and development, followed by patient behavior. If patient is a child is school going, so you have to make sure that your child you have to talk about how the child learning pattern in the school, and followed by you have to ask how's the behavior in the school. So many times that scenario might arise in exam. Let me give you one exam scenario and not really here it at it. Um, Mother of the child, he is 11 years old boy, presented to doctor that my child having behavioral issue. Okay, behavioral issue means like say he's getting angry nowadays a lot. So you have to dig out the history, why he is getting angry, how's his behavior outside, how his behavior with the other peers, and how's he is with other people. So you have to dig everything, and plus you have to don't forget to ask mother's LMP, new baby, new changes in the house, newcomer in the house, anything, everything you have to discuss on you have to ask from the parents. So here it's a win-win situation. For the proxy case, mostly 5 minute history and 5 minute management plan. And some cases you need 6 minutes to 7 minute management plan and 3 to 4 minutes for history. So like say genetic counseling is there, some Down syndrome issues are there or something, anything. But if like say based on the pediatric case, so you have to make sure that you have to deal like this. And pediatric cases ages, let me tell you, it start from up till 15 years. Okay, 15 years also considered as a pediatric case. So so you might get the case of primary amenorrhea, normal physiological, amenorrhea, or secondary amenorrhea, or some other problem. So you have to rule it out properly, but don't forget to ask patient birth, mode of birth, immunization, nutrition, and development, and along with schooling and behaviors. So,
Sorry,
Doctor,
Dr. Imran. Up till 15 years, he can ask about bind.
yes, doctor.
Okay, thank you.
Yeah, because pediatric cases mostly they will not bring like this. They will bring mostly because in my exam they brought the case of a 14 years old girl. Um, she was not getting the periods. She was getting the periods every 2 months or 3 months. Okay, mother was worried about that my child have some sort of problem. Then when I asked her that how's her the other daughter, she said that her daughter is fine. She's getting every month period. So Now it is quite sensitive to ask patient that how's any relationship or something, because this is she is a mother. So you have to go with very sensitive way, in a way, to talk about that one. Okay, if like say she is getting period with regular interval, so she don't have to worry. If she's having weight gain or some other changes are there, then you have to rule it out. But in my patient, that puberty signs was up to mark, and there was no issue. Plus, she was good, doing good. Only the issue was she was facing that she had, abnormal, what you call it, menstrual cycle. So in that scenario, mother was thinking that she might need some ultrasound or something. What I have counseled her that okay, that Mrs. Susan, I can understand your concern. Let me tell you, up till the age of 15, your child might have, your daughter might have some sort of abnormal period. She might get some sort of heavy bleeding and sometimes with severe pain. And along with, there might be a gap of 2 months or 3 months. It's pretty normal for the in this age, because she just started a periods. Okay, just 1 year ago. So you have to bring your child next time. We might rule out something, but at this point, whatever I have discussed with you and you have discussed with me, I'm feeling that she is having, we call it physiological primary amenorrhea, which is nothing to do with anything, that any bad sign with your child, because her growth pattern, her education part, her behavioral part, everything is better. Okay, she don't have to worry about it. Okay, because if like say patient having secondary characteristics, she don't have breast buds or she don't have axillary hairs or groin hairs, so we might have to worry about it. But at this point, I'm not seeing anything. But to rule out what she said, doctor, are you going to do any ultrasound? I saw at this point ultrasound is not needed because I'm not getting anything. But still, we have to bring your child. We will just will discuss. We will examine her, and at that point, we will be deciding what to do. Okay, so one thing. Second thing, there are many times you are giving some sort of plan for the short plan. Apart from this topic, whenever you're giving the short plan, like say for example, you're given 5 days antibiotic, but maybe your antibiotic was recommended for 10 days or 20 days, something like this in skin condition. Sometimes 3 months also there. So nothing harm. Okay, you are going to do the culture report along with it. Am I right? So when you're giving the culture reports, means like say culture report will come. So if like say for example, if I forget to tell that you have to take this medication for 3 months, for example, suppose for example for any skin condition, but I given for 14 days, nothing wrong. I have to add one more point here. Okay, Mrs. Susan, as per your condition, I'm giving you medication for initially for 2 weeks. And anyhow, you have to come back once the culture report will come back. According to the culture report, then we will continue the medication or we might modify the medication, because sometimes bacteria might be resistant to that antibiotic what I'm going to prescribe you. So that's the reason I have to give you 10 to 14 days forever. So just so on. So there's no harm into that one, that okay, you given the wrong thing, that you didn't mention for 3 months or 4 months, some skin conditions most of the time. And so there's no such harm. Except COPD cases, we are giving the azithromycin for 2 months or 3 months refill, that here patient have to take it to protect from any secondary infections. Otherwise, there are other conditions you can talk like this. If like say you're ordering any culture sensitivity for a skin swab or urine culture or fecal or anything. So there's no harm, doctor. So Dr. Nagma, your case is
Dr. Imran, just one question before we start.
hmm,
Sir, if we order investigations, okay, and
hmm.
examiner is not replying or he's saying pending, so follow up would be, please you come after your investigation results come. Then we'll not follow the routine follow up. Like if says there is a condition in which follow up should be 1 month, but we have done the investigations which are pending right now. So we will call the patient after the investigation reports come, right?
Yes. In that scenario, there are two statements are applicable. One applicable is that one if like say patient suffering from any acute problem. Okay, so you are going to start any antibiotics or something. For example,
Hmm.
uric acid. Your patient is hyperuricemia. Gout is
Hmm.
there, acute gout, but acute gout you are not going to initiate the patient now any kind of uric acid lowering drug, no? So what you're going to say? I'm giving you ibuprofen for the pain relief, okay? And you have to visit me after 2 weeks. Once your pain settled, then we will start. We will be initiating, okay? And we will be waiting for your reports. Okay. For example, uric acid investigation will be mentioned by that examiner at the point. But culture and sensitivity and ultrasounds, they will be saying showing the pending. Some endocrinology tests like say FSH, LH, and TSH, sometimes they will say that it's pending. So in that scenario, you can say once report come back, we will be moving to further plans. At the moment, I'm giving these things, and we will be seeing you soon and go with the safety netting and say goodbye.
Okay, thank you. Thank you.
Yeah.
Makes sense.
Okay. So, Dr. Nagma,
जी डॉक्टर
you are
इमरान.
going to you're going to see a mother who is worried about her child who is 4 years old, and she's a bit worried about and concerned about her. So take proper history. Management and examination is not required. Okay,
Okay,
start.
okay. What's mother name I have to ask?
This is agenda of every case in the exam, in OSCE exam. They will not be showing the patient mother name, except few scenarios. They will be putting that Mrs. Susan or Mrs. Sushma or whatever so on. They will be putting the name doctor, but they will not mention each and every way. Okay, so sometimes there is agenda how you are interacting with the person proxy case.
Oh,
Okay, so here you have to introduce yourself. Okay, hi, you are the mother of Master Ali. May I know your good name, please? Okay, then you have to start. And sometime the patient is there. Hi, Mrs. Susan, how can I help you today? I think you are worried about your child. May I know his name? So either way, scenario might arise. So you
okay,
have to see in a both angles, doctor. Not
okay,
in one way that patient name will be mentioned all the time. Sometime proxy name will be mentioned. Sometime patient name will be mentioned.
okay,
Okay, doctor, start.
okay. Hello, I'm your attending doctor, Dr. Nagma. May I know your name?
Doctor, Mrs. Shahnaz.
Okay, Mrs. Shehnaz. What brings you here?
Doctor, I'm a bit worried about my child Ali. He's 4 years.
Okay,
He's suffering from the problem, doctor. I can't see him while passing stool is really difficult for him. And being a mother, I am just I'm really concerned about him, doctor.
okay, okay. Okay, I understand, Mrs. Shehnaz. Mrs. Shehnaz, may I know why Ali is not with you?
Doctor, my son started school nursery now. He's going to nursery. So today he's the second day to nursery. So it was not good to send him, bring him from there. So I just thought I will come to you and I will discuss the problem with him later on. If it is needed, I'll bring him.
Yeah, sure, Mrs. Shehnaz. May I ask you a question about Ali? Is
Sure,
it okay with
doctor.
you? Okay.
Please, doctor.
Ms. Shehnaz, as you saying, he has not passing his school. Since how long this situation you are facing?
Doctor, it's been, I started his potty training about 6 months ago, doctor.
Mm-hmm.
So since then, he is a bit hesitant, and before that, I was using his nappies. I was very regular. But now
Mm-hmm.
what happened, doctor? He is going to toilet every 4 to 5 days, doctor, and it's really hard for me to, make him sit and to pass because he is having really bad struggle on passing motion.
Okay. Yeah, yeah, I can understand, Mrs. Shehnaz. It is very tough situation for you. I'm here for help you. Okay, Miss Shehnaz.
No,
May I
doctor.
ask, is Ali ever complain about pain in his tummy?
Doctor, he never complained of tummy, but he say that, Mama, something is, disturbing him down.
Mm-hmm. Okay. Did he, Ali has feeling pain while passing his stool?
Doctor, he cry actually because of that one.
Mm-hmm. Yeah. Yeah, yeah, I understand. And what about, is there any blood in it?
Sometimes there is a little blood on the tissue paper when I wipe, doctor.
Mm-hmm. Okay. Did you notice, is there any swelling down there while in his potty area?
No, doctor.
Okay. Did Ali ever soil his trouser?
No, doctor.
Okay. And what about his diet? How is it, how is his what are you giving in diet?
Doctor, I'm giving home food most of the time. There is a fruit portion, there's a vegetable portions, and everything I'm giving. But most of the time, doctor, he tried to take from outside, like say he liked some, this KFC and burger kind of stuff, and he
Mhm.
liked more candies, doctor.
Okay, okay. And what about Ali's weight? Is it normal according to his age?
Yes, doctor, he is doing well in his weight.
Okay. Did you and what about is he ever feel nausea?
No, doctor.
Any vomiting?
No, doctor.
Okay. Miss Shanaz, may I ask a few questions about his birth? Is it okay?
Yeah, what you want to ask
Okay.
for about what, doctor?
Is Ali born as a full term baby?
Yes, doctor, he was full-term baby,
And what
growing
about
fine.
did he pass stool within stool and urine after 24 hours of his birth?
Yes, doctor, he passed meconium within 1 day, on day
Oh,
one.
okay, good. And what about his immunization status?
Doctor is up to date now with my immunization.
Mm-hmm. And you told me he's most of the time want to eat outside. What about his milk intake? He's taking his milk?
Doctor, he love milk, but he don't take water.
Okay, okay. And how's his development? His milestone was according to his age?
Yes, doctor. Before sending him nursery, I have visited one of the doctor, and
Mm-hmm.
they said he's growing well, and as per his age.
Okay, okay, it's good. And Miss Shanaz, is Ali has any long-term disease?
Doctor, why long-term disease? He's very too young, doctor.
Mm-hmm. Is he taking any kind of medication?
No, doctor.
Okay. Is Ali allergic to any medication?
No, doctor.
Okay. What do you do for living, Miss Shanaz?
Doctor, I am a banker.
And what about your husband?
Doctor, he is also working in school.
Mm-hmm. And what your husband think about Ali's situation?
Doctor, he think that maybe it is a normal for his age, but he is not paying that much attention on this one.
Mm-hmm. And what do you smoke, Mister? Any of your parents smoke at home?
No, doctor.
Okay. And do you have other siblings as well, Miss Shanaz?
Doctor, I
Ali
have
has.
three children. I have total
Okay.
three children. Two are elder, actually. He is a younger one.
Mm-hmm. So all are okay.
Hmm. Yes, doctor.
Okay. Miss Shanaz, what about your last menstrual period?
Doctor, it's been 3 weeks though.
Mm-hmm. Okay. Misha, who's the caretaker of Mr. Ali?
Doctor, I'm the one who is taking care of Ali, and morning time he's in nursery.
Mm-hmm. Okay. And did you feel fatigue to taking care of Ali?
Doctor, obvious I am working woman. I have nine
Mm-hmm.
to five job. Then I come back home. I have to take care of other three children. I have to prepare everything. Of course, doctor.
Did you feel low mood most of the time?
No, doctor. I really enjoy my job, my
Oh,
work.
okay, it's good. Mrs. Ali, may I ask you what do you think about Ali's condition?
Doctor, well, I think he's scared of hurting. That's why he's
Mm-hmm.
holding on.
Okay. And what about what is worrying you most?
I'm scared that he might damage his bowel and need operation, doctor. I'm just worried about his thing again.
Mm-hmm. I hope not, Mr. Missionaries. And what do you expect me to do?
Doctor, I want something to make his body soft actually.
Mm-hmm. Okay. And we will discuss it. And how is this impacting your life?
Doctor, um, impacting in a way that he's not passing motion. So I have to worry about that. He might have, you know, spoil his dress at nursery. So a bit worried about him, doctor.
Okay, okay, Miss Shanaz, I just want to recap whatever you told me that since last 6 months, Ali is not passing his stool. Like he's passing 2 times in a week, and it is with pain and hard stool. And you are just worrying about that he could damage his gut, and it could be something serious issue. Is it all, or you want to add something?
Yes, doctor, that's it.
Okay, Mrs. Shahnaz, I am. If you will bring Ali, so I will also examine him and tell you more in a more better way. But as you told me about his condition, actually Ali is suffering from condition known as the constipation. You
Okay,
know
doctor.
what is it?
No, doctor, what is it,
It
doctor?
is actually it is likely related to how its guts is working, and
Hmm.
it is nothing serious. We can do treatment and we can cure well. Okay, so as you are concerned, he can damage his gut, so it's not like this, and it's not a serious issue. Okay, and
Okay, doctor.
I would also like to say that. There are some lifestyle measure and also there is a medicine. Okay, so
Okay.
would you do this, Miss Shahnaz?
Okay, doctor.
Okay, Miss Shahnaz, for I would like to tell you that try to increase water intake in Ali's in a different way. Okay, and you can give
Mm.
him as a juice which contains sorbitol. That is also help in cleaning his gut. Do you get me, Miss Shahnaz?
Okay, doctor.
Okay, and for as he is no, has a long issue, longer time issue, so we have to give something for the his disimpaction of his stool. That is, I would like to give him Movicol sachet. There is a 2 sachet we will give in day one, and you can increase sachet every after every 2 days. Okay,
Okay,
do you get
doctor.
me, Mr.
Mhm.
Shahnaz? And
Okay, doctor.
I will give you leaflet to how to use this one. Okay,
Hmm.
okay, that
Okay,
will
time up.
timer.
Okay, Dr. Nagma,
Mm-hmm.
good try, but you drag in the history almost took 8 minutes and 20 seconds plus in the history.
Mm-hmm.
So, yeah. Now, in this case, there are a few things to outline.
Mm-hmm.
Patient, he started just potty training 6 months ago. Okay, and he's going every 4 to 5 days, and he had a mild, little bit blood on tissue paper when mother is wiping. Okay,
Mm-hmm.
red flags. One of the best thing in this whole scenario you asked that pass meconium on the day one. This is one of the more major red flag you have to ask. If you are not asking this red flag, so your whole scenario will wash away. Okay,
Mm-hmm.
and vomiting you asked, tummy issues you asked already. So growing fine, you've gone through each and everything. And hmm, okay, so in the family history, you asked about any family history, anyone having this such problem?
For his kids, I asked. Any of your
Okay,
kids also suffering from this?
okay. So, doctor, this one you have to explain this is a functional constipation because he is having pain withholding hard stool cycle due to his potty training going on. Okay, he started potty training 6 months ago.
Yeah.
Okay, so you have to reassure there is no such thing to worry about as you worried about. He might have injured his bowel, he might have some sort of serious disease. It is not like that. So let's talk about, Mrs. Sinha, let's talk about, about the management. And next time we have to bring your child and we'll talk about, yes, you can you give in the macro goal, movie call. I think you're working in UAE maybe. That's why you're talking about movie call. So
Mm.
macro goal, doctor, macro goal we have to tell. We should not use the movie call. Movie call is the one brand name.
Okay.
Okay, you have to tell the macro goal for the weeks and months and not days. Okay, this is not 1 day or 2 days thing that I have to give you. I will be giving you like this. So you have to mention that 2 sachets started by and one by one. Diet more
Mm.
fluid. You mentioned fiber and less excess milk. You have to tell that you have to reduce milk portion because that's
Mm-hmm.
the reason patient child is going for such kind of thing and toilet routine. regular sitting after the meal, one thing. uh Footstool, okay, that you have to bring the footstool for the child, okay, and they have to, you can give reward chart, there must not be punishment. That is the important part to mention in the pediatric cases, okay. And the safety netting, if your child having tummy swelling, vomiting, and weight loss, not improving from in his health, so you have to bring your child.
Yeah. But time नहीं मिला ना, वरना मैं तो बोलती थी.
No, no, it's good, doctor. It was a good attempt. So just
Thank you.
focus, or because here mother wanted to listen more positive thing rather than other negative things. Okay, so you have to reassure in your first line when you're starting the management. Okay, so Dr. Rubina.
Sir, is this necessary
Yes,
to
sir.
take the history from the mother as well, like about his feelings and like other than idea, like
Mhm.
Dr. Nagmat ask you feeling low or tired like this, other than
Yeah,
LMP?
you have to ask, okay, because sometimes what is happening, she's not paying attention to the child because she's a working lady. Okay,
Okay.
she's having two more kids, other two more kids. So there is, we call it not negligence, but child negligence can be, we have to exclude in a child that way. How she's taking care of the children. Okay, sometimes mother says I'm working women, I don't pay attention. I just bringing take away food from there because I'm very tired. I'm not giving time. How they're taking food? Yes, most important thing, how you guys are taking food together or not. Okay, if there is no family they're not taking food together, you have to mention you have to eat together food with all children, and you have to make sure that you are not you are getting interacted, okay, so it is socially important as well as a healthy relationship, it is important.
But Dr.
Okay,
Imran, in this case, why we need to ask the LMP and others?
yes doctor, sometime my mother is a pregnant. Okay, so mother is a pregnant, she is unable to focus on the child. Okay, second thing, if like say, God forbid, if like say, if you're getting the other case, like say infection, like say chicken pox or influenza or some anything, so it might harm that fetus, like say rubella and other things. So we have to ask your LMP, ask the LMP because she's unable to do the task because she's having a hyperemesis gravidum, and might be she's having back pain, she's not able to move on. That's the reason your child is, she's not able to wipe the child properly. Okay, so Dr.
Rubina.
Rubina,
Assalamu alaikum, Dr. Imran. How are you?
fine,
Can
fine,
you tell
alhamdulillah.
me how many cases you did? I was praying, so I couldn't hear the cases.
No,
How
no, no.
many
I
cases
just
you did?
this is the first case I just started. Okay, doctor.
Okay, okay.
Yeah, yeah. Okay, Dr. Rubina, your next, your case is next.
Okay.
Mother of 10 years old girl. What is name? Khadija, come to discuss her problem, her child, daughter problem with you. Take proper history and manage no examination.
Okay. Good morning, Ma'am Khatija. My name is Dr. Rubina. How can I help you today?
Doctor, my daughter, Kinza, she's having the problem, doctor. She's keep on saying that, Mama, I'm having really bad headaches. Okay.
Mhm.
And at least she's getting, every time 2 to 3 times in a month. And she's skipping the school because of that one, doctor. And she often feels sick.
Mhm. Okay. Okay. Ma'am Khatija, Kinza is accompanying you today,
No,
or
doctor, she's in the school today.
okay, it would be a better if Kinza would accompany you so that I have a detailed examination and regarding will have a
Sure, sure,
better diagnosis about her.
sure, doctor.
Okay. Okay. Ma'am Khatija, you said that Kinza has headache. Since how long she is suffering from these headaches?
Doctor, it's been now, doctor, it's been a couple of months now.
Okay. Is it present all the time or comes and goes?
Doctor, it comes and goes.
Mm-hmm. Is there any feverish? Does she feel fever along with headaches?
No, doctor.
Any neck stiffness?
No, doctor.
Any lumps and bumps in his her body? Have you noticed?
No, doctor.
What about her appetite?
He's eating well, doctor.
And what about her sleep?
Sleep is better, but whenever she's having headache, she is unable to
Mm-hmm.
sleep on that day. She keep on crying.
Okay. Okay. Have you noticed any change in her weight?
No, doctor.
Any loose motions?
No, doctor.
What about her passing urine? Is it normal?
Yes, doctor.
Okay. Is she active and playful recently
Yes,
or before that?
she's really active and she's a sporty girl.
Mm-hmm. Okay. You said that she is in school. So how her performance in school?
That is wonderful. But since couple of months she is going down because she have to skip the school every month 2 to 3 times, doctor.
Mm-hmm. Okay. Have you ever asked about her problem that have you visited any doctor or any test done for her headaches?
No, doctor. Initially, I thought maybe she is having some school headache. You know that what we used to do in the childhood. So the
Mm-hmm.
same thing. Maybe I thought
Mm-hmm.
she's doing. That's the reason I just keep on skipping. But this time, doctor,
Mm-hmm.
it is something different. I'm getting.
Okay, okay. So have you ever asked about her condition? Like, do you notice that she's low in moods nowadays?
And doctor, no, there is no such thing, doctor.
Mm-hmm. Okay. Have you discussed that? Is there anything in the school that had happened before three
No,
months?
no,
Uh,
doctor.
no. Okay. Anything new happened in the house?
Nothing, doctor.
Okay. May I ask Ma'am Khatija a few personal questions about your health and
Sure,
relation? How is your relation with your daughter?
sure, doctor.
Yeah. What about her father? Does her father also thinks about her condition and worries like you?
Doctor, I got separation
Mm-hmm.
from my
Okay.
husband. It's been 6 months
Mm-hmm.
now, doctor.
Mm-hmm.
And moreover, he
Mm-hmm.
don't like
Okay.
to see my daughter.
Mm-hmm. Okay, I'm so sorry to hear about your separation, Ma'am Khatija. It's a very difficult time for you, but don't worry, I'm here to help you, okay?
So, doctor, thank you, doctor.
So, Ma'am Khatija, I want to ask few sensitive questions if you don't mind.
So, doctor.
Are you having any other relationship?
No, doctor.
Okay, Kinza is living with you.
Yes, doctor.
Any other siblings of Kinza, or Kinza is the only one daughter of yours?
He's the only one, doctor.
Okay, okay. So you said that his father is not interested to meet her daughter, isn't it?
Yes, doctor. He's coming and he's meeting my daughter, but I don't bother about it. But he come very
Mm-hmm.
less actually.
Mm-hmm. So might be that reason that Kinza is having this type of stress and headaches. What do you think about it?
Doctor, I
Have
think
you
maybe
ever
she's having
thought?
maybe she's having migraine like me. I used to have like when I was teenage.
Mm-hmm. Yeah, you said that she feels sick with headaches, isn't it?
Yes, doctor. Whenever it's not always, doctor.
Okay.
Weekly, monthly, 2 times or 3 times, doctor.
Has Kinza complained of any noise or lightning worsening her headache?
Yes, doctor. Sometimes she said that, Mama, I can't see the light,
Mm-hmm.
and whenever she's skipping
Mm-hmm.
the lunch, also she's getting the headache. And if she's on a
Mm-hmm.
tablet or phone too long, also she have to
Mm-hmm.
suffer from this problem.
Okay, okay. So it comes in a 3 to 4 times in a month.
Yes, doctor.
Okay. When headaches come, she is not able to do her daily activities and remains
Uh,
quiet in a dark room.
yeah, she wanted to she wanted to keep in a dark room and she don't like the noise. She
Okay,
have to close all
okay,
windows,
okay,
doctor.
okay, okay. So Mrs. Khatija, what do you think? What is going on with Kinza?
Doctor, I think I told you that I think maybe she's having
Yeah,
some
you said.
migraine like me.
Okay, 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 okay. What worries you most about Kinza's health?
Well, doctor, she's too young. She's a girl. I'm terrified. It could be a brain tumor.
Mm-hmm. Okay, okay. Don't worry. I'm here to help you and guide you about this condition. So, Mrs. Khatija, how it's impacting, as you said, that Kinza is not able to go school and her performance is going towards lower side. Apart from that, is there any effect on on her life?
Doctor, she is the only, my daughter, only daughter. So now,
Mm-hmm.
if like say she's not going to the school, she will spoil
Mm-hmm.
her future. I don't want her to see like
Yeah.
this, doctor.
Okay, okay. So, what do you want me to help you?
Maybe, doctor, she need a scan. So can you do a scan for me? And how we can reduce, doctor,
Okay.
this problem?
Okay, okay. So, Miss Khatija, you said that Kinza have headaches. It comes almost 3 to 4 times in a month, and whenever these headaches comes, she is unable to go school, and she prefers lying in a dark, quiet room. And she also feels sick. Yes, Miss Khatija, as you are thinking about migraine, she might having a migraine because the symptoms goes in the favor of having this headache. But don't
Mm-hmm.
worry, this headache seems to be feared, but it's not as harmful as you are having a concern that she might have a brain tumor. Are you getting my point?
Okay, doctor.
There are some lifestyle managements, and as you already said that there is some conflicts, family conflicts. Maybe it is the cause that she is having headaches. But if Kinza will be here, I will have some talk to her, and then we will decide what is the
Time up.
diagnosis. But ये तो सारा इसमें
Dr.
चला गया.
Rubina, no, wonderful attempt, and there was no flaw.
Excellent.
It is excellent, doctor. It's excellent. I must say it's excellent.
Excellent,
And
Rahima. You pass, inshallah.
Thank
yeah,
you. But
doctor.
मेरा management नहीं हुआ ना.
No, doctor. Let me tell you
रह
one
गया.
thing. In this case, I added one agenda, one thing. It was not in the scenario. I wanted to cover two more things that I wanted to. I don't wanted to see that you are going straight away to the migraine. So I added one point that I got separation. Okay,
Hmm.
so I wanted to distract you how you are tackling this situation. That is what I wanted to listen from you, and you gone through. Okay, now let's have a discussion on this one. This is a four-liner agenda. There is no such thing. We have to explain the likely migraine versus serious causes. Okay, because if you don't have any red flags at the present, Mrs. Khadija, there is nothing such thing to worry. Okay, as you think that she might have a migraine, as you told. So yes, it is look like it's migraine to me. Since it is you also suffer, so you know that how bad is a migraine and how you do in the migraine. So same thing she is doing in the way. She have to now let's talk about trigger management. So you have to maintain a headache diary, okay? And you have
Hmm.
to make sure your child is taking regular meals. As you mentioned that your child having whenever she is skipping the lunch, she is having headache. You have to keep you hydrate your child and limit the screen time. Okay, in case if she's getting that severe headache, we might offer you some medication like paracetamol, ibuprofen. Yes, of course, it is. There's no harm to use it, but we need before starting we need to see her. Is that okay for you? Okay, now
Hmm.
as she wanted to live in a dark and quiet room, that's quite enough good for her to get some sort of relaxation and avoid medication over usage. Okay, in case any medication is started, so make sure that she should not use the medication overly. Like say, if she don't have the pain, mild pain, she is using the medication, it will be over usage. And safety netting. Important thing, Dr. Rubina here, how you are getting, because many of us might mistake this thing, that in this case is a headache, maybe a child having a tumor. Okay, so we have to ask about red flags. Red flag, one of the most commonest red flag is a vomiting tendency, continuously vomiting, early morning headache.
Mm,
Okay,
mm-hmm.
so she don't have such thing.
Yeah.
She got a trigger when she goes to the bed late or she's skipping the lunch when she is on the tablet and phone for too long. That's the reason. So that's the reason we have to tell her to have to maintain this diary for headache diary. Red flag, it is not every day. First thing. Second thing, she is fine in between running around and going to the school. So there is no red flag. Not waking in the night, crying because of the headache. That's all red flag. No problem with her walking and talking and no fits. So means like say from A to Z, you covered everything.
Okay, thank
Okay, doctor, who was
Dr.
the doctor?
Imran, the one question is that okay, she is worried about the cancer. We should also add in that before starting the management or before starting the. Let me assure you, Khadija, that you are concerned about the tumor, but I'm happy to say
Yes,
that
of course.
after
Yes,
listening to
doctor.
you, it seems to be unlikely, and your daughter is might be suffering from the migraine.
Yes. Okay.
So
Okay, that's great. Yes, Dr. Musarrat. Hello. Okay, doctor. She's outside. Dr. Mavish.
Yes, Dr. Ram.
Dr. Mavish, uh, your case is a 18 months old boy. Master Ali's mother is worried about her child. She came to you, discuss some problem with you, take proper history and manage.
Okay.
Okay, doctor, start.
Hello, my name is Dr. Mevish. How may I help you?
Doctor, I'm worried about my child. He is 18 months, doctor.
Okay, can
He
I know your
had,
name?
doctor, I'm Mrs. Susan.
Okay, please go on, Mrs. Susan.
Doctor, he had fit yesterday. It was scariest thing I have ever seen.
All right. Anything else, Mrs. Susan?
Doctor, I saw him that his arms and legs were all jerking, not just
Hmm.
one or just on one side. It never happened
Okay.
before, doctor. And since then, he has been bit clingy, and otherwise he's doing well, doctor.
All right. Okay, Mrs. Susan, I understand that might be a very scary situation for you. Can you tell me age of Ali?
Doctor, he's 18 months.
All right. And it was the first time he had that fit?
Yes, doctor, this is first time.
And how long the episode lasted?
Doctor, it was just brief, actually, less than 1 minute, and he was fine. And I thought
All
maybe a cold weather is there, and he had a fever and runny nose this morning.
mm-hmm.
So I thought maybe he's doing, but one of my neighbors, she was with me, and she said, "No, no, 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 Susan, this is a kind of fits. Your child having epilepsy."
All right. So what did you do when he was having the fit and afterwards?
Doctor, I lost my senses. Doctor, I didn't know that what to do. I put the water on him, tablet sponging I have done, and
Mm-hmm.
then he came back. Doctor, he went floppy,
Okay.
and his eye was rolling up, and he was whole body jerking. It was a really panic situation for me. And
All
moreover,
right.
my neighbor, she scared me. Doctor, I'm just I can't sleep whole night. I was waiting for you.
All right. So you're worried that he might have epilepsy, right?
Yeah, doctor.
Okay. Okay. I can understand your worry, Mrs. Susan, but no, don't. I'll be helping you. Okay. So, Ali had. Did Ali had he had fever? Did you check it with thermometer? How
Yeah,
severe
doctor,
was it?
he had that yesterday morning, he had a temperature of 101, 102, and I was giving him paracetamol. It was going down, again coming up.
Okay.
When he got the fit, that time also he had a very high fever, doctor.
All right. And when we was having the jerky movements, was it on the one side or the whole body was jerking?
Doctor, his whole body was jerking.
Okay. And after the fit lasted, did he lose consciousness?
No, doctor, he didn't lose in consciousness, but he was, his eyes rolled up actually.
Okay. And did he bit his tongue?
No, doctor.
And was there any urine leakage afterwards?
No, doctor.
Okay. So he had only one episode since yesterday.
Yes, doctor.
Any problem with his urine? Has he complained any
Uh,
pain or burning?
no, doctor.
Okay. Any cough?
No, doctor. He had only
Any
this
pain?
problem.
Okay, all right. Let me go back, Mrs. Susan. How was Ali born?
Normal delivery, doctor.
Okay, and it was at term at 9 months.
Yes, doctor.
Any complications during or after delivery?
No, doctor.
And how about his vaccination? Is he up to date with his
Yes,
vaccinations?
doctor. Yes, doctor.
Okay. So he's 18 months old. Can he walk or run without support?
Yeah, doctor. He's a playing boy, and he's always running here and there. He's catching the things.
Okay, all right, good. And how is his diet?
He's feeding well. I'm giving him forage. I'm giving him milk and everything.
All right, okay. So is he growing well like other
Yes,
kids?
yes, doctor.
All right. Okay, Mrs. Ali, Mrs. Susan, do you have any family history of epilepsy?
You mean to say in my family?
Yeah, in your family or in your husband's family? Is there anyone
No,
having
doctor.
epilepsy?
No, no one.
All right. Any other significant illness?
No, doctor.
Okay. Mrs. Susan, is Ali taking any kind of regular medicine?
No, doctor.
Okay. Can I ask where is Ali right now?
Doctor, he's with his grandmother, and he was sleeping overnight. He couldn't sleep, so that's why I didn't brought him.
All right. All right. If possible, please bring him here so that I can have a look at him as well. Okay.
Okay, doctor.
Okay. Can I ask when was your last menstrual period?
Doctor, it's been 3 weeks now.
Okay. And your cycles are regular?
Yes, doctor.
All right. Anyone at home? Do you work, Mrs. Susan?
Yes, doctor. I am a teacher.
Okay. So when you're at work, who Ali stays with whom at home?
Doctor, he's staying with grandmother.
All right. And how is his relation with his grandmother?
It's good, doctor. He's always attached with her.
All right. It's good. That's good. So, Mrs. Ali, you told me that you fear that he might have epilepsy. Any other worries that you have?
Uh, Doctor, I don't know whether it will be this epilepsy will be for lifelong, whether he will die because of this one.
I hope not, Mrs. Susan. And any particular expectation from this consultation?
Doctor, what should I do if it happen again? And do I need to call an ambulance every time, like I did
Sure.
yesterday?
Yeah, that's a very valid question, Mrs. Ali, Susan, and I'll be telling you about it in a while, okay? So let me sum up. You've told me that your son Ali, who's 18 months old, had a fit yesterday because of fever, and it lasted a few seconds, and you're worried that he might have epilepsy. Okay, one thing more, Mrs. Susan, do you have any other kids apart from Ali?
No, doctor, he's my only child.
All right. Okay. So it would be better if he was here so that I could have a look at him. But I want to run a few tests if it's okay with you.
Okay, what you want to run, doctor?
I want to do a complete blood count, a urine complete, and an ESR and blood sugar levels, fasting blood sugar levels,
Why you want to do, doctor?
so that I could rule out any other infection. Okay.
Mm-hmm.
Okay, and if required, what you have told me, Mrs. Susan, till now, it seems that he's had that fit during an episode of fever, so we call it as a febrile seizure. Do you know anything about it?
No, doctor.
Okay, what happens that sometimes in kids up to 5 years of age, sometimes during high episodes, high grade fever, there is an enhanced episode of electrical activity, enhanced electrical activity in the brain, which causes some jerky movements in the kids. Okay, but
Okay,
it is a
doctor.
self-limiting condition. It is we cannot label it with epilepsy without confirming it. Okay, and in most of the cases it subsides after 5 years. All right.
Okay, doctor.
So there are high chances that Ali might be suffering from febrile seizures, and it's a totally benign condition. But we need to, since he had his first episode, so we need to confirm it. So I'll be, if you bring him the next time, I'll be referring him to the child specialist, so that he could order him a test which we call as EEG. It's just like looking at the electrical activity of the brain. All right.
Okay, doctor.
Okay, but I should tell you that even if the EEG is negative, it will not rule out epilepsy. But looking on your history of Ali, it seems highly unlikely that he might be suffering from epilepsy. So, what you have to do whenever he gets another episode, please make sure that you remove any harmful objects from his surroundings. All right?
Mm-hmm.
And also remove the tight clothing, and if possible, please turn him over to his lateral position and avoid putting anything in his mouth. You understand?
Mm-hmm.
This the fit lasts only for a few seconds, so just stay calm, and just make sure you don't put anything in his mouth. And the doctor, the child specialist whom I'll be referring to, might also give you some suppositories of diazepam, which is a drug which is given during an epileptic fit. So you can put it in his back passage as well. All right.
Mm-hmm.
And if the fit doesn't subside, you can give him another suppository. But if the fit lasts longer than 5 minutes, then it is an emergency, and in that case, you need to rush him to the emergency. Do you get me?
Okay, doctor.
Also, if he has more than two episodes of fits in a single day, in that case as well, you need to get
Time
him checked
up.
with the specialist.
Time
Okay.
up. So I don't have to add anything in your case. Throw you go on in a way that you touch each and everything, even the event details and type and frequency, red flags.
Yeah.
Eyes and counseling. Management, you have to, I just add one point here. As you
Yeah.
mentioned that your doctor will be giving you back pain medicine, so you have to tell that these are the antipyretic to comfort to reduce the fever.
Hmm.
Okay, it will not prevent the
Yeah.
fit, so you should not give every time because there might be one scenario arise that overutilization of the medication that his child is getting better, so mother or father want this medicines. Okay, so it might arise.
Okay.
Okay, so you
Okay.
should tell this one. This one is a mandatory thing. Otherwise, there is no such thing to add in your scenario.
Dr.
Uh,
Imran, can I ask one thing?
yes, doctor.
Because patient is first time febrile seizure, so can we immediately order still the EEG?
Doctor,
Is it?
EEG will not tell anything because patient is not in the fits.
Yeah, so doctor actually, doctor, I think Mavish, she said
Yeah.
I will want to refer him for the EEG, so that's why I was wondering.
No, that is she added. Then second line she mentioned that it will not be relevant. So she actually counter
Okay,
that one. Okay, she counter
okay,
that
just
thing.
for
Okay.
patient concern to make it clear.
Yes, doctor. Doctor
Okay.
Mozma.
Dr. Mavish, she did really well, doctor. Excellent. She'll pass, inshallah.
Thank you.
Yes.
Okay, Dr. Mozma, your case is what I should give you, doctor. Okay, yes, mother of a 5 days old baby, term baby, come to discuss her child concern, take proper history and manage. Here, I didn't mention patient name, I didn't mention patient age, sorry, mother name. So both up to you now, Dr. Mozma. Start.
Mother of 5-year-old baby.
5 days old baby.
5 days old.
Yes, doctor, start.
Uh, Good morning, Dr. Mosma here. Uh, can I know your name, please?
Doctor, I'm Mrs. Ali, and my son, I'm just worried about my baby, doctor.
Okay, Mrs. Ali. Can I know the name of your son?
Doctor, his name is Kamran.
Um, uh, how can I help you, Mrs. Ali?
Doctor, we have noticed that his eyes and skin looks yellow.
Can you tell me more about it, Mrs. Ali?
Doctor, he's 5 days now, and normal delivery, and we came back home 2 days after 1 day, and he's a term baby, born 39 week. He's doing everything,
Yeah.
but his skin and the eyes, having more concern about this thing too, because look like he's having something wrong in his body.
Okay, okay. Okay, Mrs. Ali. Uh, uh, Mrs. Ali, for how long this yellowness of the eye is present?
Doctor, just 2 days, 3 days, we are noticing. Initially, it was second day, third day, but it was
Mhm.
not that much. But now it's more prominent, doctor. On day three, it was
Oh,
more actually, and it is more
oh,
obvious today.
okay, okay. And okay, Mrs. Ali. Yeah, Mrs. Ali. Now I will ask few questions about the Ali, about the Kamran. How is it?
Doctor, he's doing well. He's feeding well. He's eating well.
Okay. Mr. Dilip, how was the birth of the Kamran? Was it a natural or cesarean? Was it a normal delivery or the cesarean section?
Doctor, I told you it's normal delivery, doctor.
Okay, okay. And is his immunization, which was given at a birth, BCG was given?
Everything was given, doctor, at the birth, whatever required.
Okay. Okay. Is he on breastfeed or top feed?
Doctor, he's on exclusively mother feeding.
Mother feeding. Okay. Is he passing urine? Is
Yes,
he
doctor.
okay? And any yellowness in the urine?
No, doctor, it's normal because we are using the diaper, so it's nothing such thing, doctor, over there.
Okay, okay. Any fever?
No, doctor.
Okay. And okay, okay, Mrs. Imran, Mrs. Ali. Okay. And is he sleeping more than usual?
No, doctor, he's doing well. He's sleeping, as doctor told that in the 5 days baby might sleep up to 20 hours. It's fine. So,
And okay, Mrs. Ali. Okay. Uh, Mrs. Ali, now I want to ask a personal question for you from you. Is it okay?
sure, doctor.
Okay. Um, uh, no, is Kamran is your first child?
Yes, doctor.
Okay, okay. Um, okay, Mrs. um, hmm. Okay, Mrs. Kamran. As hmm. Actually, Mrs. Kamran, after talking to you, now let me. Do you have any idea what's going on with Kamran?
Doctor, well, I'm thinking that maybe people say that this yellow is normal in a newborn.
Okay. Do you have any particular worries?
Yes, doctor, we have Google and saw that the thing about the brain damage from high jaundice. We are really scared, doctor.
Okay. Okay. And and how this condition is affecting you of yellow of the Kamran cells.
Doctor, he is our first baby, so me and my husband couldn't sleep whole night after Googling this thing.
Okay, okay. Uh, hmm, okay. Anyone in the house who smokes?
No, doctor.
Okay. And who is okay. Anyone in the house who is taking alcohol?
No, doctor.
Okay. Okay. And as you already told me that his father is also concerned about him. Okay. Okay. Mrs. Ali, now let me summarize it. You told me that Kamran is having a yellowness of the body from the last 3 to 4 days, and now you are quite concerned about it. Okay.
Yes, doctor. Yes, doctor.
Okay, okay, Mrs. Okay, Mrs. Kamran, can I ask why Kamran is not with you?
Doctor, he's sleeping, so that's why I didn't disturb him. Just before, wanted to discuss with you. If anything
Oh,
abnormal, then we'll
oh,
bring him here.
yeah, yeah. Now, let me tell you that when you come next time, I want to see you, Kamran, with you, so I can examine him and will be in a better position to tell you that what's going on with him.
Okay,
Okay.
doctor.
Now, how about if I offer few investigations for the Kamran of the Kamran blood, like the bilirubin levels, CBC, and the liver function test.
Okay,
Okay.
doctor.
Okay. Now, after talking to you, Mrs. Kamran, the most probably condition the Kamran is having is the normal physiological jaundice.
What is this, doctor?
Um, okay, Mrs. Kamran, this is a jaundice that occurs in a newborn baby due to the
Mm-hmm.
high levels of bilirubin in the blood. Okay,
Mm-hmm.
the bilirubin is the product which form in the body due to the red cell breakdown. Okay,
Mm-hmm.
and let me assure you that this condition is not so serious. Okay,
Mm-hmm.
as you are thinking that it may cause the damage of the brain, but the jaundice which develops immediately after birth within a first day is can be the dangerous can be the danger, but as you told me that this jaundice developed after 3 days, so it is most likely this is a physiological jaundice. Okay.
Okay,
So
doctor.
how about that? If you increase is a fluid intake, like feed him more than usual.
Okay,
Okay.
doctor.
Okay. And and uh, 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 and as far as his so I want to see you after the blood investigations. Okay.
Okay, doctor.
Okay. But if in the same time, if there is a worsening of the symptoms and his and his yellowness of the eye increases, and if there is any fever, so please go to the emergency. Anything you
Okay,
want to ask about?
okay, doctor.
Okay, I'm also giving you a leaflet about the physiological jaundice, so you can read it if you have any question. Okay, thank you.
Okay, okay, doctor. Dr. Mosma, you still have 1 minute and 30 seconds, but let me tell you, you covered many things, but in history, you have to ask a few things. That dehydration status, okay? How many diapers and nappies she's changing, whether are nap dry or wet, okay? Whether he's poppy yellow or dark yellow or normal yellow, and he wakes for free feeds, not too sleepy, and we're just making him awake or he wake himself kind of stuff. Plus, you have to ask about pale stools or chalky stools. If like say this is a red flag, fever is red flag, pee is bit yellow, but if it is a dark like your cola, you ask already. So it was done. Pregnancy was fine, no blood group issues. This one you have to ask. This is a golden question in this history taking. That is there any problem with your husband and your blood group mismatch? So you have to ask about RH incompatibility, and Explanation is bit more towards the patient's concern. We have to explain the patient for physiological and pathological genders briefly, and we have to emphasize the need of serum bilirubin and plotting on age in hours chart. Okay. Plus, we have to mention that mostly in 5 days old child with a good feeding, normal stools have physiological or breastfeeding jaundice. Okay, we call it, but level must be checked. So that's the reason I'm going to offer you a few blood investigation. May I? Okay, so you have to proceed with that one. Okay, and for this outline, you have to make sure that if the blood threshold then we will be encouraging, we will be observing, like say, if your reports come less than normal or normal, below the threshold, we will be encouraging the feeding and observe. But in rare cases, your child might need a blue light. Okay, you should not have phototherapy. You have to say the blue light. Okay. In rare cases, we might need a transfusion if, like, say, there is a RH incompatibility. Okay. So, for the learning purpose, you have to understand if your child, safety netting, if your child having poor feeding, lethargy, high pitched cry, fever, pale stool, or dark urine, urgent review needed. So, in this, there's something which you need to capture
Yeah.
that she is a Mrs. Ali and for child name is Master Kamra. So you are not focused in this way, doctor. Please be focused.
Okay. Okay. Thank you, doctor.
Okay, welcome, doctor. And doctor, Dr. Nadia, first of all, my humble request, because since you are new over here, um, here no one is allowed to comment other than that who is examiner over here. If there is something, you can talk to that person directly, not in the meetings. Please, refrain from this thing. Thank you, doctor. Okay, Dr. Saima is there. I think so, Dr. Saima. Okay, Dr. Saima is not there, then who else can be doctor? Dr. Dania, ready to do the case? Dr. Amna.
Okay, doctor, I'm here.
Okay, Dr. Amna, your patient is a mother of 7 years old, um, Mr. Mohib, Master Mohib. She is worried
Okay.
about her child. Take proper history and manage the case. Examination not required. Start.
Okay.
Okay,
Hello, my name is
start.
Dr. Amna. May I know your good name, please?
Doctor, I am Mrs. Ali.
Mrs. Ali. Mrs. Ali, how can I help you today?
Doctor, I'm a bit worried about my child. He's still wetting his bed most of the night. I'm really embarrassed, and doctor, so he's also now tired of this thing, doctor. Can you do something for
Oh,
me?
yes, this must be upsetting you, and I'm here to help you in every way. Mrs. Ali, may I confirm your son name is Mohib, right?
Doctor, I'm holding here 1 minute. Doctor, I'm holding here 1 minute.
Oh,
Dr. Sangeeta, Dr. Nadia, we will discuss this later because now session is going on. Please, this is sensitive issue. I should not, otherwise I will be forced to remove the people from here. Thank you very much, doctor. Please maintain this one. I mentioned when I started the group, I mentioned, and it was being observed very good. But if something is going wrong, so I will be forced to stop it. Thank you very much, doctors. And start, Doctor Amna.
yes, sir. Mrs. Ali, may I confirm your son name is Master Mohib?
Yes, doctor.
How old is Mohib?
Doctor, he's 7 years old, doctor.
Okay, can you tell me more about his bedwetting, please?
Doctor, nowadays he's having 4 to 5, 6 nights per week. He's wetting his bed, and sometimes his bed is full of this urine.
Okay. May I know, Mrs. Ali, in 1 week, how many times does he has this problem?
Doctor,
per
it's
week?
5 to 6 night per week.
Oh,
So
okay.
dry in the daytime about 3.5. But now you
Oh,
see, this is a lot, doctor. I'm very tired to
oh.
keep on changing this bad things.
Yes, Mrs. Ali, this must be really difficult for you as a mother. I can understand. Mrs. Ali is how for how long he is having this problem? Is this since he is born?
No, doctor. He was bit good, and his potty training was good. He started, the thing. He was doing good, doctor. But suddenly, I don't know what happens. 2 to 3 years, he's keep on getting. But initially, I thought maybe he is still young to have such kind of thing. So I was ignoring. But now,
Oh,
unfortunately, it came up, doctor.
okay. May I know, Mohit drinks water more than often?
Yes, doctor.
Does he eat a lot?
Yes, doctor.
Okay. Any burning or pain while passing urine?
No, doctor. He's having normal, doctor.
Okay. Does he complain of any constipation? Any hard stools?
No, doctor.
No. Okay. May I know, Mrs. Ali, how is your behavior? How is your attitude towards Mohib when he does all this?
No, doctor, I'm a very gentle person. I don't have any problem, but I'm feeling bit pity for my child, doctor.
Yeah, I really appreciate this behavior, Mrs. Ali. And do you have other kids as well?
No, doctor, he's my only child.
Okay. Mrs. Ali, I'm going to ask you questions, though they may not look relevant with Mohib's active complaint, but I just want to know, I just want to make sure he's growing well. Is that okay with you?
Okay, doctor.
How was Mohib? How was your pregnancy with Mohib? Any complications?
No, doctor, it was fine.
Okay. How about his immunization? Is he immunized till this date?
Yes, doctor.
Have you brought immunization card with you?
Yes, doctor, he's up to date, his immunization.
Okay, okay. I hope you will bring his card next time so that I can see he's not missing on any important vaccinations. Is it
Sure,
okay?
doctor. Sure, doctor.
Okay. How about his appetite? Is what does he eat in a day?
Doctor, he's mostly taking sugary items. He's taking this Coca-Cola and Pepsi kind of stuff. But I'm trying to stop it, but it's really hard for me, doctor.
Okay, we'll discuss over this as well. How about his development? Is his growth up to mark?
Yes, doctor.
Okay. And okay. Anyone in the family has any long-standing illness in the past? Like anyone in the family has diabetes, high blood sugars?
No, no, doctor.
No. Okay. Does he has any fever?
No, doctor.
No. Okay. May I know with whom Mohib lives in the home? With you
Doctor, me
and
and my husband and my mother-in-law, doctor.
okay. Is Mohib's father also concerned about Mohib's this problem?
Yes, doctor. He was a bit worried about, and he said that now next week, doctor, he have to go for sleep. For one part, there was one trip, so he wanted to participate. But I'm really worried about him. How he will be participating, doctor? Uh,
Okay.
it's really hard for him to, hold on. He will be getting bad, and over there, might be bullying, and he will feel embarrassed,
Yes.
doctor, over there.
Oh, no, no, do not worry, Mrs. Ali. We will sort out this as well together, inshallah. Oh, sorry. And Mrs. Ali, I want to know about his school performance.
Doctor, he's doing really good, and he's always, in top three positions.
Okay. Mrs. Ali, any idea what is causing this nighttime bedwetting?
Maybe just he's going for deep sleeper or lazy person. I don't know, doctor.
Okay. Anything that bothers you most other
Yes,
than
doctor.
changing the bed
Doctor,
sheet?
yes, doctor. He's a 7 years now. He's starting to refuse sleepovers, and he cries about it. Really, doctor, and it's really bothersome for me.
Yeah, this must be worrisome for you. And what do you expect from today's consultation?
Doctor, I just want to know what we can do at home and whether there is a medicine if needed.
Okay. And how this has affected your and Mohib's life so far?
Doctor, it affected a lot.
Mm-hmm. Okay, let me summarize what you said, Mrs. Ali. You came today with the complaint of your son Mohit, who is 7-year-old. He started bedwetting for past 3 years, and you are
Hmm.
concerned about his this behavior. He might get some bullying since you are going somewhere to pay visit somewhere, right?
Okay,
And you
doctor.
want me to rule out the cause. Okay. Uh, Based on what you told me, I suspect he has a condition we call nocturnal enuresis. Have you ever heard about it?
No, doctor, what is this?
Mrs. Ali, actually, it's a condition in which the kid's bladder it becomes distended, especially at night, and this bladder actually transmits some signals to the brain.
Hmm.
Okay, but brain could yes, it transmits some signals to the brain, and brain could not respond it well. So the
Hmm.
kids can't wake up at night, and they urinate in the bed.
Okay, doctor.
Okay, I just want to reassure you this is not anything serious that you should worry about. With proper
Hmm.
some lifestyle measures and with medicine, we can overcome this problem. Okay,
Hmm.
how about if you start? I really appreciate that you took out some time out of your busy routine and came and discuss about Mohib. It shows you are a caring mother. Mrs. Ali, how about if you use some enuresis alarm? The alarm you will keep it in Mohib's pants. Okay. Once he will urinate, once the urine will pass, the alarm will ring, and he will wake up and he will start to urinate in the washroom or in the toilet.
Hmm. Doctor, really, it is a really big device that he will just get disturbed, doctor, and he will might be
No,
scared of that one, doctor.
no, he won't be scared of this because it has two parts. One part will be kept under his pants, and the other part will be in the room. Once the alarm will ring, we can adjust the setting of his sound as well.
Okay, doctor. Okay,
Okay.
doctor.
Yes. So once the alarm will ring, we have two parts of this alarm actually. One you can also keep in your room, and one he can also keep in his room. But
Okay, doctor.
Mrs. Ali, the thing is, this alarm will take 3 to 6 months to work. Since you told me that you are going to pay visit to someone's house, how about if I give you a medicine called desmopressin 200 microgram? Is it okay for
Okay,
you?
doctor.
It will give
Okay,
you
doctor.
instant effect actually.
Will it be harmful for my baby?
No, it won't be harmful at all. All you have to do is to prevent giving him any water before 1 hour of desmopressin and 8 hours after giving desmopressin.
Okay, doctor.
Okay, so hopefully you will continue your same behavior. You will not scold Ali, neither you nor your husband. Hopefully, with this enuresis alarm, and he will overcome this problem. And you told me that Mohit takes sugary and fizzy drinks. How about if you
Mhm.
stop giving him such things? Can you do this?
Doctor, I'm trying my best to do it.
Yes, kindly replace all these sugary drinks with water. Okay.
Okay, doctor.
And how about if you take Ali, if you take Mohib to the toilet before he sleeps?
Doctor, I'm trying, but his sleep get disturbed, doctor.
Before he sleep, like if you're going to put him in the bed, how about if you take him to the toilet? And
Yes,
even
doctor, I can do it, doctor.
yes, if Mohib is scared of dark, you can turn on the light of washroom as well, so that he can
Okay,
easily
doctor.
go and
Time
yes.
up. Well done, Dr. Amna. Clear pass. There is no flaws and something. The best part in that one, you explained very well how to use enuresis alarm. I was not expecting that thing you're going to explain it. It is really beyond that wonderful job. I am really happy to listen to you. In a way that you've gone through, engage the patient, the mother, which is more important because here in this scenario, this is a really difficult scenario. Here, passing margin is really less. When there is a examination part is there, at least we have some sort of margin that we can do something in examination. No, here with the management, how you're going to counsel a mother, parents, or proxy father, or whatever, so on. So if you like say you are not explaining that we will be having less margin to pass this scenario. That was very well explained, and there was nothing such thing missed actually. Let me tell you. So I don't have to tell anything. in this way. We will be moving to next one. And second thing, I would just wanted to request everyone here. I have only 2 or 3 male doctors, and almost more than 100 candidates are here. I respect everyone equally. And second thing, here, comment part, I will be disabling from now onwards. I will not allow anyone to comment in there because this is a kind of, because crucial time is going on. Someone having 20 days left for the exam, someone having 22 days left for exam. So I don't want to do this stuff in a way that there must be some sort of conflicts. Yes, of course, everyone having their own explanation, everyone having their own observation. I might miss a lot of things. The thing, whatever, but honestly, at speaking, I'm giving almost 90% my reviews. 10% I might miss some sort of, in a way of occupied somewhere. But I am just giving the views, whatever I have learned from the different passage of time, with the passage of time. Okay. So please don't comment on anyone's performance. No one have right to comment here. I can understand everyone's feeling. Everyone is equally respectable for me. Neither who is, I don't know. Many of you are senior than me. Many of you are junior than me. Many of my colleagues. So I am really just more way respecting everyone. So please, I don't want you to use any harsh words or something because this is not such thing. Because we are all mature, we grown up people now. Really, just like say, we are beyond that one. Okay. So many of you knows me since we had a AKT, almost now going to be 1 year and more than 1 year. They are my colleague is in this part, in this journey. And it is my request, please maintain everyone's respect, okay? Everyone is respectable for me. Everyone is here for learning. I'm also here for learning, okay? I'm learning from you guys. But the thing, if like say something like this comments going on, no, it will be forcing me to remove the person who is doing this thing. So I don't have choice because I don't want to do it. But if something goes wrong, I will be removing because I don't want to spoil others. Um, others learning whatever they are learning over here with them. Okay, and please take care of it. It should not happen again, doctor. I hope so. Everyone understood that what I'm to say because I don't wanted to say these things. Just a couple of days, I was keep on. I was thinking, okay, I have to keep this one something low profile thing. But today it's raised up, so I have to come up. So Dr. Iram Qureshi, you are ready for the
Sorry,
case?
sir, I'm extremely sorry from my side.
No, Dr. Sangeeta, it's okay, doctor.
One
Dr.
question,
Iram,
Dr. Ahmed, Dr. Umran.
yes, doctor.
If mother ask me from where I bring this alarm, what the answer?
You can tell the mother that it is available on the pharmacies or you can buy online.
Okay, thank you.
Okay. Yes, doctor.
Sir, I am on duty. Kindly किसी और से करा दो.
Okay, Dr. Sangeeta, you're the next doctor.
Okay, sir. Sure.
Thank you, doctor. Dr. Sangeeta, you are facing a mother who is a mother of 2 years old child. Um, Again, Master Ali, because I don't have many names, doctor, so I have to keep on repeating the names, okay? So take proper
Okay.
history and manage the case, doctor.
Okay.
Start.
Shall I start, sir?
Yes, doctor.
May I know the mother's name?
Doctor, this is the agenda of the case that you have to know the
Okay,
mother's name.
sorry. Sorry.
Okay, doctor.
Okay,
Thank you.
okay.
Start.
Hello, I'm Dr. Sangeeta. How may I help you? Am I talking to mother of Ali?
Yes, doctor. I am Mrs. Khadija.
Okay. Yes, Mrs. Khatija, how may I help you today?
Doctor, I'm just worried about my child. He's Ali, 2 years old, doctor, and he's fainting after crying. It's really, troublesome for me. Why get fainting whenever having excessive cry?
Okay, I'm sorry to know about the Ali's condition. I will try to help you, Mrs. Khatija. May I know few questions regarding the Ali's condition? Is that okay with you?
Sure, doctor, please go ahead.
Okay. When did you notice this happening with Ali?
Doctor, initially I thought maybe he's crying and that's the reason he's having some sort of thing, but it's now terrifying me. And it happened almost now 4 to 5 times in 2 years, doctor.
Since 2 years and 4 to 5 times in a week, you notice that it is happening in
No,
the
no,
4 to 5 times?
it's 4 to 5 times whole in 2 years.
2 years. Okay. Did you notice that once he hold the breathing and is getting blue?
Doctor, he cry hard. Okay, he stop breathing and turns blue and sometimes very pale. And
Oh,
then he goes limp for a few seconds, doctor.
okay. Does you notice? Does he Ali has any jerky movements at that time?
No, doctor, never had such kind of things, doctor.
And the how long does it last? The holding of the breathing?
Doctor, it's based on that. Sometimes we are just trying to make him, relax, and we just holding him. So it happens, but mostly it happens whenever he's get angry or hurt.
Okay, I can see that. Mrs. Khatija, Ali is your only the child, or he has other siblings?
Doctor, he's only child.
Okay. May I ask regarding the Ali's birth to see the clear picture of the condition, Mr. Khadija, is that okay?
Sure, doctor.
Okay. How was Ali delivered? Was he delivered normally?
Yeah, this doctor's normal delivery.
Okay. And your pregnancy was normal?
Yes, doctor.
Okay. Does he get immunization up to date?
Yes, doctor.
And does he develop normally? Have you?
Yes, doctor.
Okay. And what about his diet, nutrition? He's
Doctor
taking
is
healthy
doing
diet?
well. Yes, doctor.
Okay, that's really great. And Mrs. Khadija, have you noticed then when Ali has this symptom condition, does he pass urine at that time?
No, doctor.
Okay, that's great. Mrs. Khadija, what do you think the Ali might be what he has the problem?
Doctor, I don't know if he is having a fit, maybe, or maybe his heart is stopping beating.
Okay, I'll surely tell you regarding this. And what his father thinking about this?
Father also is a bit scared, and we were really a bit scared of that one. Maybe we thinking that he might die one day because of his these spells.
I hope not. It's really a big worries regarding being a parent. Mrs. Khatija, I would like to ask that what do you do for a living?
I'm a housewife, doctor.
Also,
Housewife. Sorry, I'm taking water, doctor.
a
My throat is
How,
dry. Okay,
housewife. Okay. And when was your last menstrual period?
doctor. 6 weeks.
6 weeks. By any means, you can be pregnant.
Doctor, I'm thinking that might be.
So you haven't checked your pregnancy test.
No, doctor.
Okay, okay. Okay, Mrs. Khadija. So I would like to ask, is there anyone in your house smoke?
Uh, no, doctor.
Okay, okay, and okay, Madam Nadia. Does Ali has taking any medication on regular basis?
No, doctor.
Okay. And what about his urine? Is that is all fine with his anything a problem with the urine?
No, doctor.
What about his bowel motions?
No, doctor. No, normal, doctor.
One thing I want to forget to ask, how many times does he has this condition in a week? How frequently it
Uh,
happens in a week?
Doctor, it happens. I told you in 2 years, it happens. This is fourth or fifth time, doctor, and it's
Okay,
not that much, doctor.
okay. And what do you think might be the cause of Ali's condition?
Doctor, I don't know. Maybe doctor, his heart having some problem.
I'll discuss in detail in later, Mrs. Khadija. And how this affecting on your daily life?
Doctor, he got a day before yesterday, and since then, almost 3 days now, we are unable to sleep. It happens after 8 months, doctor.
Okay. And in which way I can help you from today's consultation?
I just want to know whether this is dangerous or what to do if when it happens.
Okay. May I know why you did not bring Ali today?
Doctor, he's sleeping actually.
Okay. Let me recap. Mrs. Khadija, you presented to me as your son Ali is 2 years old, and since uh, two, uh, 2 years, you are saying that he has some breathing, holding problems. So you think that it might be the cause related with the heart, and you want me to explain what is the problem behind this. Is that all, or you want to add something else?
No, doctor, that's it.
Okay. Mrs. Khadija, if you will bring Ali in the next session, so I can examine him and I can tell you regarding his condition in a very good manner. So, for what you have told me and Ali's symptoms is suggesting that Ali might be suffering from the condition is we can call the breathe holding spells. Do you heard about it?
No, doctor, this is something dangerous you're talking about. Breathe holding
No,
means he
one.
will stop breathing, doctor, one day.
No, 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 it's not dangerous, Mrs. Khadija. I will let you reassure you. It's a normal condition. Once the baby cannot express his thoughts and his things, desires to the parents, and sometime in the reaction, he can face this type of situation. And it's a event in which the trigger, like you told me that once he cry or want something, so in that situation some for a few seconds the breath can hold. Okay,
Mhm.
and it is a spontaneously recover. You told me that it's a few seconds has happened, and once he cry at that time.
Okay, doctor.
Are you getting me? Am I clear to you?
Yeah, doctor.
So I will reassure you that it is not a serious condition, but it will take time. Once will time being the Ali will be get normal. So for this, I will like to suggest you some investigation for Ali to see the exact cause of if there is anything behind it. Uh,
Okay, doctor.
Okay, so I would like to do some complete blood count of the Ali's status and urine analysis as well.
What else,
Okay.
doctor?
I would like to do these tests only.
Anything else, doctor?
Uh, Ultrasound, I think.
Okay, doctor. How can I do with this management, doctor, if there's something gone wrong at home?
Okay,
What to do,
yeah,
doctor?
I'll explain you in a very simple manner. When Ali has this problem, just let him relax and try to let him on the lateral side. So, and do not try to put anything in his mouth. And once he get from the condition, just keep him relaxed. Okay, uh, try to avoid the any dangerous triggers around him, so it will be better for him to recover okay, in a safe safety manners. Okay.
Okay.
Okay, just try to keep him relaxed. Please do not try to do some mouth to mouth breathing, and do not to push, and do not try to let him keep him relaxed. Okay,
Okay,
at
doctor.
the time of the spells that he face. Okay, Mrs.
Okay, time up,
Khadija.
doctor.
Okay,
Dr. Sangeeta, time up. Well done.
thank
Doctor,
you.
few things let me add on in this way. Uh, Proxy cases are mostly straightforward case. You don't have to dig up so many things. Okay,
Yes,
so
yes, sir.
he never had some sort of this thing in before in the life. So he had only 4 to 5 spells. He's 2 years old. So
Yes,
he
sir.
don't have any red flags like say jerking and
Hmm, hmm,
fits
hmm,
and
hmm,
floppy or something.
hmm, hmm, hmm,
He okay. So here mostly we have to focus on the counseling. First of all, we have to explain that typical breath holding spells is
hmm,
mostly the benign. Is okay. So
hmm,
common
hmm,
in toddlers usually resolve 4 to 5 years. We have to explain, and we have to check the iron status because iron
hmm. Sir,
deficiency can
CBC,
worsen
yes,
the
yeah.
spells. Yes, No, CBC, you're talking about iron. Examiner want to listen about iron,
Okay,
doctor.
iron. Especially we have to say iron.
Yes, doctor.
Okay.
CBC and iron. Iron
Okay.
deficiency can worsen the spells. Okay.
Yes.
And most about now teaching the parents. Okay. Mrs. Khadija, may I teach you something and may I discuss with you something that how to stay, how to manage if in God forbid if this position come. So you must have stay calm. You should not shake the child. Okay. Don't
Okay.
put anything in the mouth. Child safety is matter and avoid reinforcing with excessive attention afterwards. Okay,
Okay.
this is a
Okay.
two-liner agenda. Examiner want to listen from you. This is the one,
Sure.
the main, soul of this whole scenario. Safety
Dr.
netting you
Imran, what was
mentioned.
the meaning of reinforcing excessive attention means?
Doctor, like say for example, if I'm the one who got fits, oh, sorry, he got
Yes.
this one. My mother keep on counting my breathing. My mother keep on keeping on eye on me. So I will be
Mm-hmm.
getting irritated. So you see, this patient is getting child is getting irritated, and then he
So,
started
Okay.
getting angry, and
yeah.
he's getting angry, and after that he's doing. So we have to make sure that we are not doing the such thing that he should get agitated and he should get this position again.
So mother usually used to put the mouth to mouth breathing at that time to get the baby back from the
Yes,
this
yes,
breathing
doctor.
holding is,
Yeah,
yeah.
yeah. No, no,
Thank-
your case is clear pass. There is no such thing. Just few points in the management you have to add on.
Oh,
Okay.
thank you so much, sir. It means
Yeah,
a lot,
doctor.
sir. Thank you.
Doctor.
Dr.
Okay.
Imran,
Yes, doctor.
do you want me to be SP?
Sure, doctor. I'll be sharing this thing with you.
Okay.
Okay, doctor. Give me 1 second because there are a lot of cases are there today, doctor, and we have to go through one by one. Doctor, check your message. Check your message in the Zoom.
Okay.
Okay, and Dr. Saira,
Yes, Doctor. Assalamu alaikum.
Dr. Saira, you are the next doctor to deal with the patient. And again, for everyone, remember management here is more important and it's taking history taking because there is no life-saving examination. Examination part is there, we will be saving our life. Examiner in the orientation program also, they used to say that dealing with a proxy case is more difficult because this is a straightforward case and straightforward. So you should not give so much effort in asking so many things like say multiple red flags, multiple differentials. No, you have to make sure that you have to ask to the point and to counsel the patient because counseling is mandatory for your from your side. They wanted to listen.
So
You
sometime
want
no, we
to
forgot to ask what question we have to
no no
ask.
no.
So that is why we are in a little
No,
confusion, sir.
Dr. Sangeeta, it is acceptable, doctor. It is acceptable. There is no such thing. There's not. You're not asking something to blunder. Okay, there is a two things are there. One thing you're asking, okay, but it should not be irrelevant. Let me tell you, in this case, if you're asking about lumps and bumps, no, it is irrelevant.
Okay, sir.
Okay, how
Thank
mother
you.
will be knowing that patient having lumps and bumps in neck or something? Have she
So,
is she the medical professional? No, definitely no. She's a housewife.
okay, sir.
Okay,
Thank you.
so
Thank you.
examiner don't want to listen irrelevant questions.
Okay, sir. Thank you. Thank you.
Okay, today we have two Dr. Sangeeta. There is one more Dr. Sangeeta has entered in the room. Okay, okay,
I'm the
Dr.
previous
Saira.
one is the newcomer.
Okay. Dr. Saira, so your case. Okay, doctor, ready?
Yes, Doctor.
Okay.
Okay, start.
So, doctor, instructions. Just one.
Yeah,
Six
yeah.
weeks old mother of 6 weeks old child came to discuss condition. Please, history, no examination, but management plan. Start.
Yes, start.
Good morning. I'm Dr. Sarah here. May I know your good name, please?
Yes, I'm Mrs. Madina.
Yes, Mrs. Madhya. How can I help you?
Doctor, my kid is not fine since so long.
Okay. May I know your name, child name?
It's Master Ali.
Master Ali. Okay. Can you explain more about Mr. Master Ali?
Oh, it's sorry. Yeah, Master Ali. Actually, he's screaming every night for so many hours, and we are exhausted because of his screamings.
All right. All right. His age, as you mentioned, is 6 weeks old, right?
Yes, doctor. He's 6 weeks old.
Okay, Mr. Ali. So he's screaming in the night only, nighttime, as you mentioned.
Yeah, doctor. Around 5, he starts screaming, and up till 8 to 9 p.m. He keeps on screaming, and then he pulls his knees on the belly also.
Okay, all right, I can
Mm.
understand. Mrs. Madia, might be difficult for you. Can I ask you more questions?
Sure, doctor.
Since how long this is a thing you are noticing? How many days now?
Doctor, it's been 4 weeks now.
Oh, okay, 4 weeks. Every night, early morning, you mentioned, right? And
Yes.
how is overall his health in the daytime?
He's good in the daytime and he's feeding enough. He's smiling, but as soon as there's a near sunset, he starts to scream.
Yes, I can understand. Might be difficult for you, Miss Madia. Anything else you
Mhm.
want to share with me?
Yes, doctor, just this, and I was thinking maybe something having
Hmm.
worms in
Okay.
his stomach or what.
Okay, Miss Madhya. And how about is the urine? Does he his nappy change? Is a like he's you I making nappy wet proper
Yes, yes,
and
doctor.
his stool
Yes, doctor. He's passing yellow stools and good wet nappies.
good way. That's great. And did he pass the like 24 hours before in after birth he was fine completely, right?
Yes, doctor.
Okay. When he cry in the night, did you notice any like bluish discoloration of the lips?
No, doctor.
Okay. Any breathing spells did you notice?
No, doctor.
Any lumps and bumps here you notice in the stomach?
No, doctor.
Okay, all right, Miss Madhya. Miss Madhya, I want to ask about yourself. How do you think about this condition?
Doctor, it's just been 6 weeks and this is my first child. So I really don't know how to handle a kid and I'm living alone with my husband. So I'm really worried. Maybe there's something wrong with the feed or
Yes,
on the
yes, I can
stomach.
understand. Yes, I will help you. I'll do my help. I'll do my best to help you, Miss Nadia. Do you
Mhm.
smoke? Anyone smoke in the home?
No, doctor.
Okay, and may I know the your last period date?
Doctor, still it's 6 weeks. I'm still not menstruating.
6 weeks. You are not menstruating. He's only
I
the
am
complete.
I am menstruating.
Okay, and the complete breastfeeding only, or did you use any other formula milk?
Doctor, I'm giving him formula milk
Okay, okay, all
also.
right.
Hmm.
Also, okay. And how is was birth like? Is a complete 9 month delivery
Yes, doctor, on term.
on term, normal or cesarean, Miss Madhya?
Normal.
Normal delivery. Any complication in the pregnancy?
No, doctor.
Okay. And how about his body weight? It was fine at the time of birth.
Yeah, last time we checked with the nurse, she said he's growing perfectly.
That's great. And how about the vaccination? He's up to vaccination, Miss Madhya.
Yes, doctor. Yes, doctor.
That okay, Miss Madhya. Okay. What's your idea about this? What's concerning you more?
Doctor, maybe something wrong with his stomach. I don't know.
And what do you expect from me?
Doctor, just tell me something we can calm her down because every evening he's crying a lot.
I'll do best to help you. Don't worry, Miss Madhya. And Miss Madhya, can I sum up it for you? Your
Sure.
baby, Miss Master Ali, 6 weeks old. He has every early morning, like midnight, he start crying at around 5. And as you mentioned, he's drying up the knees also there. Otherwise, then he's fine. You think something may be worm, or you're worried about this? Quite worried. So you want to know what is the reason and you want the solution. Is this all, Miss Madhya?
Yes, doctor.
Miss Madhya, I just want if you can bring Master Ali here so we can examine him. It would be fine if you can bring next time. Where is he now?
He's with my husband. He's at home sleeping.
Okay. If you can bring, so next time I can examine. Is this fine, Miss Madhya? Can you do this?
Yes, doctor, for sure.
But
But is
from
it
from the,
is it dangerous, doctor? Should I bring him tomorrow?
I will explain to you. Doesn't look like dangerous for me, but definitely I just wanted to examine. I just want to take touch his tummy and lower back passages.
Mm-hmm.
Is your
Okay,
husband
doctor.
also worried about him?
Yes, doctor, he's so worried.
Yeah, I just want general physical examination of baby. Other than this, whatever you have told me, it's look like condition like infantile colic. It's a condition, is a normal
Mm-hmm.
condition, Madam Miss Madhiya. For unknown reason in the babies, it happens normally. But it will improve or
Mm-hmm.
resolve after 3 to 4 months of age. Are you getting me, Miss Madhiya?
Yes, doctor.
Okay, as you think is a worm or any serious condition, nothing look like serious for me. And but let me assure you, I will give you leaflet about this infantile colic. Also read about this. And other than this, if you can just do a massage on his tummy, can you do this, Miss Madhya? Like a bicycle, hips and back. Like if you can massage on tummy before sleeping in
Mhm.
the night.
Okay, doctor. But he
And
cries at 5 p.m. So when should I massage
yes,
him?
massage in the night before he can sleep well. And could be
Okay.
as you have added the formula milk, I'm little concerned about this. If you can give the formula and avoid in the night time, can you do this?
Okay, doctor. Doctor, I'll try.
Okay. And you can join some social group or can take from advice from elders. Also is a very common condition how to calm the baby. Nothing to put like worry about this. When you feel baby is crying, just take him in your like nap and try to make it calm and massage. It's only because of
Okay,
some
doctor.
like a simple colic. It's nothing to worry about this.
Okay, doctor.
And Miss Madhiya, I just want to know, as you looks also most worried and looks like worried. How about your mood?
Yes, doctor, I'm feeling good. I'm happy that I'm having a kid. Finally,
Yes,
it's been 2 years we've been trying, and now I have. But I'm
congratulations,
happy,
Miss.
but just concerned because of him.
Yes, I was just thinking. So, do you sleep well?
Yeah, doctor.
That's great. I'm happy to see you. And anything else you want to know from me?
That's all, doctor. What if it doesn't resolve? You think that I should stop the milk?
Actually, I will encourage you to just give like breastfeeding. I will encourage you.
Okay. Okay,
Yeah,
doctor.
I will not. But if may I know what's the reason you started formula milk?
Doctor, the nurse told me that I don't have sufficient for his feet, so that's why they said to start on that.
Miss Madhya, it's like exclusive breastfeeding. I will encourage you. It will help you for your child development also. Actually, formula
Mm.
milk. If you take your baby in the lap, try to like feed more your baby with latching, with the taking baby close to you. Your milk in like excretion will be increased.
Okay, doctor.
How about your baby's suction is okay? Like he's sucking well?
Yes, doctor. He's
Yeah,
feeding well.
he's feeding well. So, Miss Madhya, nothing to worry about. I will still encourage you if you try this exclusive breastfeed till at least minimum 4 months.
Okay, doctor. I'll try.
We prefer till 6 months, and if you can do avoid to reduce formula milk.
Okay, doctor.
Okay, and try to get just massage in the tummy. And there are some bicycle, some exercises are there to move the
Mm.
hips just to reduce the colic or excessive gas. Otherwise, your child looks healthy, and still, if you can bring, I can examine him.
Okay, doctor.
Anything else to want you know from me, Miss Madhya?
No, doctor, that's all.
Okay, in case any severe tummy pain or you feel fever, a child is lethargic. Lethargic means his nappies are dry. Any change in the color in the stool like blood, please come back to me immediately. I'll go to the emergency.
Okay, doctor.
Okay.
Okay.
Oh, yeah, time up.
Thank you.
Dr. Saira, well done. It was thoroughly motherly teaching. You're engaging the patient, that mother very well. And most over, there are the thing we have to teach, which is we call it strategies are there. Okay, you have to tell the patient that holding gentle and holding the child in a way, gentle rocking, white noise, sling use, burping, and try at small feeding, feeding it. Okay, feeding, try small feedings. Okay, try feeding adjustment if bottle feed child is there. Okay,
Okay, yeah, maybe overfeeding. Yes, could be the
yeah.
reason.
Okay,
Yes, yes.
emphasize parental support and rest. Okay, check maternal and mental health that you checked already. Safety netting. Uh, so that was wonderful case. Doctors, many times we will be facing that we will be having a lot of time what to talk in next. So if everything finished over there, so you can chit chat with the proxy. You can say, okay, so what's your plan with your daughter? So in my case, it happened with primary amenorrhea. So she was saying, my time finished, almost my time was remaining 1.5 minutes. And I started talking, okay, so what's your daughter future plan? She want to become doctor. Ah, really nice. So it will be really good for you to bring a child and you chit chat. So it will be, healthy way. Otherwise, just you're looking at child, SP's face, SP is looking at you. It will be, another negative impact. So you can bring up her something issue which is not related to the question, but it should be in a good environment. Okay. So doctor, next is Dr. Sadaf.
Okay. Dr. Sadaf, are you there?
Yes, I'm here.
Okay, doctor, give me one
Okay.
minute. I think I shared that case with you, doctor.
Yes, there
Yeah,
is one more
yeah.
case to share. Hmm.
Okay. Okay, doctor, agenda.
Yes, 1 second.
And I'll be taking time for my prayer. So by meantime, you can continue. Okay, just put the timer from your side, doctor.
Oh, okay.
Okay, and just 10 minutes. I'll begin for prayer. Thank you. Doctor, you can start from your side.
Yes, just doctor, 1 minute. I'll start.
Okay.
Okay, so Sadaf, Dr. Sadaf,
Yes.
mother of 8-year-old boy came to discuss his condition with you. Please proceed with history management. No examination required. Your time starts now.
All right. Hello, my name is Dr. Sadaf. How may I help you? Sorry, can I know your name, please?
Yes, doctor, I am Mrs. Sajda. I'm here for my son, Master Imran. Oh, Master कोई और ले लेना. Master
Ali?
Hardik. Yeah,
Sorry?
Master Hardik.
Okay. Okay, so Mrs. Sajda, how may I help you?
Yes, doctor, I just am so concerned about my kid.
All right, can you tell me more about it?
Doctor, he's not sitting while we having a meal. He's climbing, fidgeting here and there, and he cannot sit still and focus.
Mm-hmm. All right. So since when are you noticing these changes in him?
Doctor, it's been now almost 3 to 4 months. I'm noticing. First, I didn't give it a thought, even though my relatives told me that he's more active than other kids. But now, since 6 to 8 months, I'm bothered by this condition.
Right. So did you also notice that he was a bit more active than others around him of the same age group?
Now I feel, doctor, yes, others are telling me, so I noticed, and yes, he is.
Okay. Okay. Can you tell me where is Hardik right now?
He is. He went to play with his friends. Doesn't listen to me properly.
All right. It would have been better had you brought him along, but it's all right. Can we have a little talk about him? That's
Yeah,
okay.
sure, doctor. Yes, doctor.
All right. Okay. So can you tell me when was Hardik born? I mean, when was he born normally or through a C-section?
If he was normally.
Okay. It was a full-term pregnancy?
Yes, doctor.
Okay. Any complications during or after the pregnancy?
No, doctor.
All right. And are his vaccinations up to date?
Yes, doctor.
Okay. And what about his diet? What is a typical daily diet like?
Doctor, he eats everything we give it to him, but he's not sitting still. I have to just run around him and ask him to eat something. Sometimes he bothers me a lot.
Okay. So is he a picky eater?
No, almost he eats everything, but it's so difficult for to make him sit down.
All right. And what about his growth? Does he seem to be growing well like other peers of his age, like his height
Yes,
and his
doctor.
build? All
Yes,
right.
doctor, he
Okay.
does.
Okay. So, does he have any other long-standing illness, any medical condition?
No, no, doctor.
All right. So, does he go to school?
Yes, doctor.
All right. So, how is his behavior at school? Did the teacher complain ever about the
Yes,
similar thing?
doctor. Now I'm getting calls from his teachers, and they are saying that he's not finishing his homework, and he's getting distracted by everything. And even his friends, they are not interacting with him anymore. They are saying like he's too much.
Right. So, has ever Hardik complained of any bullying or being left out from play,
No,
like you
doctor.
mentioned?
No, doctor. I guess he is the one who bullies other. So I don't know. Nobody bullied him.
So, do you think he's bothered by this thing that his friends are not playing with him anymore? Has he mentioned anything like that?
No, he didn't.
All right. So, at home, have you noticed that he isn't doing his work properly or he's forgetting things, like he's not responsible of his things?
Yeah, he does gets distracted easily.
What about his homework or other daily chores? Does he do it regularly himself or he has to be told again and again?
He has to be told again and again. He's behind in reading and maths. And
Mm-hmm.
doctor, he gets in trouble a lot. Like when he cannot do something, it upsets him a lot.
Mm-hmm. And what about other children? Do you have any other children?
No, doctor, he's my only kid.
Okay. So, have you noticed that he sometimes plays quietly and sits in a place?
Sometimes, but doctor, he's more like jumping in here and jumping here and there.
Okay. All right. So, anyone else in the family having similar condition?
No, doctor, that not that I know of.
Your husband or you? Have you heard about it before?
No, doctor.
Okay. Okay. So, have you noticed any unusual, any marks on his body?
No,
Any
doctor.
bruises, any scratches? All right.
No.
Okay. Okay. So, does he want to interact with others?
Yes, doctor. Like whenever we go in a crowd, he wants to go say hi to this auntie or that uncle or this kid, that kid. It's so difficult to catch him.
So he's social, right?
Yeah, he's social.
Right. And so who else lives with you at home?
Me, my husband, and this funny kid.
hmm And what does your husband think about it?
Doctor, he's like, maybe he's just a kid. Maybe that's why.
Is he also bothered by it?
No, doctor, he's like, he's a son. He's my son. It can happen. It's normal, but I don't think it's normal since relatives are telling me now. I'm having the calls from the tutors.
hmm So have this occurred ever that he's trying to harm anyone, like any animals or anyone else around him?
No, doctor.
Okay. Okay. So what do you think about his condition?
Doctor, one of his teacher said he is having
Mhm.
ADHD.
Okay. So what are your concerns?
Doctor, I don't want him to be labeled with any disease.
Right. Yes, I can understand your worries, Miss Sajda. Okay, so how do you want me to help you?
Just any medication, doctor, if he needs any medication. Otherwise, just tell me what to do, how to control him, or is it normal?
Yeah, we'll be discussing that. And I can see that this condition is really impacting you. You're quite frustrated about it. Anything else you want to add?
All this, doctor, that's it.
Right. Okay, let me sum up, Miss Sajda. You told me that you are quite bothered about your son Hadik, and because he's fidgeting, not sitting, and he has been having complaints from the school also. He's quite distracted, and you are worried that this might be ADHD, and you want any solution or any medication for this. Is that all?
Yes, doctor. 2 minutes.
Right. So, Miss Ajda, I think after talking to you, I think the condition that uh, Mr. Master Hardik might be having, it could be ADHD, but as you are worried, but I cannot be the one who can confirm this. Yes, he might be having some signs of the disease, but I would still refer you to the pediatrician and also to a pediatric mental health doctor. All right.
Mm-hmm.
So he would be the one to confirm this diagnosis. But yes, even if it does, if the diagnosis is confirmed, still don't worry. There are many treatments available that can manage his condition. All right.
Okay, doctor.
Okay. I would suggest you that can you keep a food diary for Hardik so that we know that if he's having extra sugar or what kind of food he's taking, or if any any diet might be triggering his condition, right?
Okay, doctor. Yes, doctor, that's good
Okay,
idea. But doctor, what is
okay.
this ADHD? Can you please tell me, is it
It's
a
a
disease of
it's a
heart?
behavioral, yeah, it's a
Hmm.
behavioral disorder in which the child becomes hyperactive, and it's not under his control. It's not his fault. So we cannot tell that, like you were saying, he's a naughty boy and he's a funny child. So only a specialist can confirm that, but it is a condition in which there is hyperactivity, but so the specialist would be confirming it, right? And yes, there are some drugs for it that would might have to be started. All right. And
Okay,
I would be
doctor.
providing you with a leaflet about his condition. And I would also suggest you to go to the pediatrician. And there are many online support groups for that. And you can talk to other parents who have a similar condition of their
Yeah.
child, if
Okay,
that helps.
doctor. Okay, time's up. Yes. Dr. Imran is there or not?
Doctor, I've just joined already. So please continue with Doctor. I was just listening her half
Okay.
management.
Okay. So, yes, and this was suspected ADHD. It's since he's fidgeting and climbing, you asked about his homework, and yeah, one thing that whenever someone is talking, he interrupts. Two things that he's getting distracted, and one is he's attention deficit. Oh, sorry, attention deficit and hyperactive. He's not sitting, and the second
Mm.
one was he's
Distracted?
interrupting. Yeah, he's
Interrupt.
interrupting because his hyperactive cannot focus for longer. And duration you asked, and about his homework, school activities, and other thing, everything was covered almost. And patient for the counseling point, we have to tell them what is the ADHD. Basically, it's persistent pattern of inattention and hyperactivity, impulsivity across settings. But we have to say it in our own words. Sometimes the kids are hyperactive and not uh, focusing properly. So for further ruling out, I am referring it to the child specialist, and
Mm-hmm.
if that's possible, or if he needs any talk therapy or any medicine, they will be telling you for further. Right now, I need to see Master Hadik in person. I will be running some blood tests for him, and I don't know which blood test, but We have to screen him for anemia or anything else like that because sometimes kids are irritable.
Mm-hmm.
What else? Need information from school and parents. Proper questionnaire will be done for ADHD. First line is behavioral and educational strategies, and parenting support is major in this. Like Dr. Sadaf, you took 8 minutes in history, so if it was covered in 5 minutes, like so we can to 3 minutes on child management and 2 minutes on parenting support.
Mm-hmm. Right. History was long, yeah.
Doctor, how to explain like parenting support? Like you will get involved in some group, same.
There are many kids who've been diagnosed with this condition, and it's not uncommon these days. But I will be connecting you to the support services or support groups like this. The parents, I will be giving you the leaflet for online groups or the contacts, so you can contact them and how they're doing with the kid or how they're coping with this condition. They might tell you further something like
Mm.
this, like you know.
Yes.
And
And how about
one
for
thing.
the child? Just we refer to the brain doctor, and maybe they will start like as you mentioned, like talk therapy or
Yes,
medicine.
yes.
Mm.
Talk therapy or medicine depending upon the questionnaire and the specialist input. And one thing
Mm.
you didn't ask about screen time.
Mm, yeah.
Screen time and spending time with the family.
Okay.
Screen time was missed. Otherwise, you did all. Okay, so next.
Okay, doctor, give me 1 second, doctor. Dr. Iram Yasir.
Yes,
Yes, doctor, ready for that one?
yes, of course.
Okay, so the case is she'll be putting description and I'll be putting the timer, okay?
Okay, doctor.
You.
Dr. Iram, just give me 1 second to read this. Okay. Okay. So, Dr. Iram,
Mm-hmm.
your patient, Master Fayaz, 4-year-old boy, came to discuss his. Her mother is there to discuss his condition. Please proceed with
Mm-hmm.
history, management plan, and no examination required. Your time starts now.
Hello,
Yes,
I'm Dr.
start.
Iram. Hello, I'm Dr. Iram. May I know your name, please?
Yes, doctor. I'm Mrs. Aisha.
Mrs. Aisha. You are the mother of Master Fayaz, right?
Yes, doctor. Yes, doctor.
Okay, okay. How can I help you?
Doctor, I just am so worried about my son. He doesn't talk a
Mm-hmm.
lot, and he seems to live in his own world.
Okay, I'm so sorry to hear about this. Can you please tell me something more?
Since he is 4 years now, doctor, I want him to be very fluent in talking, but he uses very few words to talk
Mm-hmm.
and to ask
Mm-hmm.
things, and sometimes he doesn't really point to show us the things. He more pulls us to show us something.
Okay, okay. Must be very, very concerning for you. I can truly understand your concern. I'll try my best to help you. Okay, you told me that he's not speaking at all. Very few words. Can you tell me what words he's speaking up till now? Mama or
He's
Papa?
taking, yeah, he's taking these words. He knows many names and many other
Names.
words. Like he said,
Okay.
want
Mm-hmm.
food, only 2 words. or
2 words.
give
Okay.
me something like this. 2 to 3 words he
Okay.
says, but he says
He
it
says
not complete.
not complete words. Okay. And did he started speaking like these few words from the like 1 to 2 years age? Was he speaking?
Yes, doctor, he was growing
Yeah.
well, but
Okay.
I feel
Okay.
he is talking late than
They're
others.
talking late. Okay. And do you feel that he is responding to your commands when you call him?
No, doctor, he rarely looks at us when we call his name.
Okay, he rarely looks at you. Okay. And
Hmm.
does he seem to play with other kids of his age? Very, like he's a playful boy?
No, doctor, he just stays in his own world and
He's
just
in
runs around
onwards.
or lines up his cars. He
Okay.
doesn't talk to anyone else.
Okay. Okay. Have you noticed that he is always more close to a single object or one or two toys or something like this?
Yes, doctor, he doesn't show his toys to anyone.
Okay. 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 Sorry, I forgot your name. Your name was
I'm Mrs. Aisha.
Mrs. Aisha. Okay, Mrs. Aisha, I would like to ask some few more questions if you don't mind.
Sure, doctor.
Regarding his birth, how he was born, it was a normal delivery.
Yes, doctor, it was
Hmm.
normal.
So he's 5 years, 4 years old. So his initial years, he started to walk or learn the basic things according to his age. Or you noticed any delay at that time also?
Doctor, to be honest, I didn't put enough attention since I have 4 kids to take care of, and somehow,
Okay.
yes,
Mm-hmm.
I couldn't give him
Okay.
enough attention.
Okay. So you didn't notice that he's keeping up with his age. Okay. Is he fully vaccinated?
Yes, doctor.
Okay. Okay. And other than this, how is his diet?
Doctor, his diet is good, but he doesn't
He
likes
eats
to eat with
everything?
everyone. Yeah.
Okay. Okay. And is he going to any school up till now? He started school yet, or any nursery or daycare something?
No, doctor, we tried putting him in nursery, but he doesn't
Mm-hmm.
go. He wants to stay home. So we thought
He
maybe
wants to
after
stay.
5 years. Yeah.
Okay. Okay. And how is his weight?
He's carrying on weight, but still I feel
Mm-hmm.
like he's thinner than others.
He's thinner than others. Okay. Okay. So you told me that you have four more kids. So you are a housewife or you work also?
I work, doctor.
Okay. And what is his father job?
Actually, his father and I are running a cafe, so yeah,
Mm-hmm.
the grandmother is at home. Sometimes I have to stay home for the kids, and sometimes my
Mm-hmm.
husband. So this
Mm-hmm.
is it.
Okay. Okay. And he is the youngest in the house, or he's what is his number in the family among his siblings?
Yes, doctor, he is the youngest, and I wasn't expecting to be
Mm-hmm.
honest. So he was an
Okay.
unplanned child.
Okay. And how are things like at your work and are you able to manage the things with his condition? How is it
Yeah,
affecting you?
doctor. Yeah, doctor. Sometimes I have to take him to my
Mm-hmm.
workplace, and sometimes he cries, and he's so annoyed by the loud noises. So I have to keep him at home.
Mm-hmm. Mm-hmm.
So it's
Okay.
very much
Okay.
difficult to change his routine.
Mm-hmm. Okay. And okay. So do you have any idea what's wrong with him?
Doctor, someone told me he's a condition, autism. I'm not sure what
Mm-hmm.
is it.
Mm-hmm. Mm-hmm. Okay. And so this thought is concerning you, right? Any
Yes,
other
doctor.
worrying thoughts other than being autistic?
Yeah, doctor. Since about his future, how he will do things on his own.
Okay. 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 See, Mrs. Aisha, other than this, I want to ask when he was born, did he undergo any hearing test at birth and in the first 2 months?
No, doctor, as I told you, we didn't give him proper attention.
Okay. Okay. So far you have told me that you have a 4-year-old boy who is suffering from difficult behavior, and you think that he's also not speaking, and his behavior is somewhat different. You are worried that he might be autistic, and you
Yes,
want me to
doctor.
help you with that, okay? Uh, may I know exactly in what way you want me to help you today, other than finding out what's wrong with him? Anything particular you want from me today?
Maybe, doctor, I'll bring him the second visit. Can you please confirm if
Mm-hmm.
he's having this disease?
Of course, this is a mandatory. This is what I'm going to start with when I will explain that anything that I'm going to say now is not like for sure. Of course, anything I will be finalized once I'm seeing him, okay? And I see
Mm.
him and examine him, only then we can say anything. So if I say anything, so that will be just a provisional thing, okay? As you're already concerned about him being autistic, suffering from autism, yes, this is my utmost worry at the moment. He might be suffering from autistic disorder, and there is also a possibility that he might be having hearing disability, because of which he is suffering from this. And secondly, it could be also a speech delay. But for this, it's very important that we have to get him seen by a specialist. His hearing test, everything should be done, and only then we can say that he is suffering from this condition. Are you getting me?
Okay, doctor. So is it
Okay,
some blood
but
test, doctor?
it will be a hearing test, okay, and there is no blood test to diagnose this autistic disorder. It is normally just by seeing the patient and just doing some hearing test. Normally, we come to the conclusion. Are you getting me?
Yes, doctor. 2 minutes remain.
Okay, okay, Mrs. Aisha. So please, already he's 4 years age. So it is a condition in which the child, they suffer from this problem because they don't start hearing the things when they are not listening. Their hearing impairment is there, so that's why they're not able to speak also. So they might need some aid to help them hearing. And then yes, it is very difficult to take care of such children, but with the timely management and with learning timed, when we make them train and make them learn things with the time, uh, things become much easier. But in that case, you being as a parent will have to play the important role. Are you getting me?
Yes,
Okay,
doctor.
so it is a very big thing. So once we see him and we move forward with the diagnosis, and then it will be very important that we support you as parents, that things are manageable. Many parents are taking care of their children with this condition. There are many good organizations and special centers are there to make these children learn the things, help them with their hearing and speaking, speech therapy, and the dietitians are there, physiotherapists are there to make them engage in different activities. Okay, so but in that case, we will also be having, you will be in touch with me, and you can come back to me anytime you want. And secondly, we will also have parental education sessions for you as well, so that we keep in contact with you. Whatever difficulties you are suffering, we will be dealing with you and guiding you. Okay?
Okay, doctor.
Okay?
Time's up.
Okay, I forgot. Also, I wanted to ask her LMP also. Sorry.
Okay, Dr. Ira, have you asked
Yes.
about father's profession and father's interaction and whether she,
He said
uh,
that
huh?
he said
Yeah,
that they both run the cafe. Interaction I didn't ask. Yeah.
Okay, and does he know
Yeah.
that you came to see discuss his you came to discuss the problem of your child?
No, that also I didn't ask. It is also
That's
mandatory,
mandatory.
doctor?
Yeah, this is mandatory in
Ah,
this case.
okay, okay.
Okay,
I didn't
that
know
we have
that.
to see that how much support is there because this case mostly based on that support from the family.
Mm-hmm. Okay.
Okay,
So
support
we
for
have
the
to ask
parents.
the father
Okay.
knows that you are coming here. Okay.
Yes, yes, okay. And
Mm-hmm.
father don't know, and father is very careless about the child because he's thinking he is a disabled. So I'm not going to take care of
Mm,
him. So We will be calling it poor family support. Okay, so in that way we are going to
Okay.
get some sort of different approach.
What will we do in that case? Because she's saying she's also not giving time and she's busy. In case he
Yes,
says that
now
father
you have
is
to
not.
you have to tell him that this is not a disease. Okay, this is spectrum.
Mm-hmm.
Okay,
Okay.
and this is not a disease to cure. Okay, this one need a multidisciplinary team to get full assessment. First of all, we are going to assess the child fully. Okay, with your
Mm-hmm.
child
Mm-hmm.
pediatric team, also pediatric neurology, the psychiatry. So many things are involved. Okay, ENT will be involved, IN will be involved. So multidisciplinary team will be involved. And early
Mm-hmm.
intervention, speech therapy, behavioral and communication programs, structured support at a nursery or school because some sort of shadow teacher they will be giving, and moreover support of the parents we have to see, and according to that one we have to tell the agenda. If the parents say that
Mm-hmm.
no doctor, my husband don't want anything and he's thinking something, so we have to take in a different way, and we have to talk to the our social services team to take care of the child.
Okay. So in
Yeah.
case the parents are not interested, we have to check with the social services team. Okay. Okay. That I didn't know,
Yes.
doctor. Thank you
Yes,
so
doctor,
much.
we have to take out it. Okay, so any
And
Mm-hmm.
case
Dr.
where this
Imran,
if, yes doctor.
sorry, I'm just taking 5 minutes to pray, okay? I'll be
Okay,
back.
so any case which is involving disability, so we have to talk about that the partner know about this thing or no. Any confidentiality
Mm-hmm.
things are there, disability for long term, long run disease or
Mm-hmm.
long run management needed. So we have to know
Mm-hmm.
that whether your partner knows or not.
Mm-hmm.
Okay.
Okay, Dr. Imran, I have a question. In my
Yes,
differentials,
doctor.
I wanted to ask two things, but since she was saying me more, telling me more things related to autism, so I kept on that. But I think I didn't ask any differentials. So in that case, what could be two or three differentials that I must rule out, like a speech delay
Uh,
because of something else,
Speech delay,
or is
early
it okay?
mention. Yeah, it's speech delay. You have to ask patient learning capabilities, social interaction, social cues, okay, and
Mm,
patient is able to walk or no. So these are things where this
mm.
patient have using which is dominant hand, whatever. So on, so many things are there. But
And what about the
um,
red flags in that case? In autism, I couldn't think of anything as a red flag.
harming self,
Harming self. Okay, okay.
okay, and throwing the thing
Mm.
and taking some sort of the thing hitting head to the wall, okay, and hitting things on
Aggressive
the head.
behavior.
Yeah,
Okay.
aggressive behavior.
Mm-hmm.
Okay, aggressive behavior is
Mm-hmm.
another red flag which we needed. Okay, and and the safety netting also just think we have to focus on this a few points.
Okay.
Uh,
Okay.
Okay, so doctor, in the group I am seeing Dr. Sophia is there. So Dr. Sophia, are you
Dr.
interested
Imran,
to do the case? Yes, doctor.
excuse me, Dr. Imran, please,
Yes,
can
doctor.
you give a bit more explanation about the ADHD? How are we going to
Uh,
explain it?
okay, ADHD explanation you're talking about.
Yes,
Doctor,
and
there are
management also.
yes. Now, these are the few liners I will be giving. As per your practice and as per your time and as per your knowledge, you can expand this one, okay? First of all, we are going
Mm-hmm.
to explain ADHD and briefly. We have to talk about persistent pattern of inattention or hyperactivity or impulsivity across the setting, okay? Second thing, we have to need information from the schools and parents. Use structured questionnaire. Okay, there are some questionnaires are there. First line behavioral therapy is here, and educational strategies are there for parenting support. Because sometimes parent cannot be able to do this ADHD child to cope with. They might get aggressive, they might hit the child, they might harm the child, because they know that
Mm-hmm.
this child is not going to listen them, so they beat him. Okay.
Right.
Yes.
Mm-hmm.
Second thing, medication. Medication not at our level, it will be under specialist level. Okay. They will be giving you some sort of stimulants. Okay. And we have to discuss if impairment is significant. If, like, say, child is heavily impaired about because of ADHD, so we will be discussing some medication part. But we might tell the parents, okay, the specialist might start little dose of medicine. Okay.
Mm-hmm.
Yes. Screen for coexisting problem like say learning difficulties, ASD or anxiety. Anxiety in a way that father is not patient. There is one scenario. Just we had discussed before that one. Dr. Amna did. In that one, that mother say that I am separated or she is divorced. Okay, or
Mm-hmm.
father is not around. Father is not giving time. So we have to see patient is anxiety because patient is attached to the father more. Okay, we have to see this one address. Okay, we have to address this issue also.
Right.
Okay, yes. And you have to reassure the parents that your many children, they do well with the appropriate support and management. Okay, so mostly this patient need a support from the family. So we have to see how strong the support of the family.
Mm-hmm. Right.
Okay, so one
Okay.
is need information. We have to get gathered information from our school or parents. That as she already did, Doctor. I think Doctor. Name I forget. Second thing, first
Oh,
line behavioral and educational strategies are there. Like say in that one, we are talking about parenting support. And third one is the medication, not by us. It will be under specialist. So to tell Mrs. Khan, we will be discussing. I will be referring you in once I will see your child, and after that I might refer your child to specialist.
okay.
Okay, and we will be
Right.
screening for any coexisting problems. Like say we have to ask how's your husband is doing. So she said I am divorced. How long you're divorced? Is your husband? Does your husband comes to you see your child or no? No, doctor, he doesn't come to. He's 6 months. He even haven't seen him. Since 6 months, he's having the problem. Now we have to think about something which is we call it what you call it separation anxiety or what is adjustment disorder, whatever so on. So there are so many things that we have to rule out that one.
Right.
Oh, but that's the reason child is aggressive because he's small child. He wanted to see his father, so he will be doing some sort of different way to show up. I wanted to see my father.
Mm-hmm. Okay.
Yes,
So it could be attention-seeking behavior also.
it can be doctor anything. Attention-seeking behavior also can be.
Right. Okay. Thank you, Dr.
Okay,
Imran.
and I will come. Dr. Sophia, I was talking about you.
Yes, sir, but thank you, sir, but not today. Maybe some
No,
other
it's
time.
okay. But you are participating this sorry in January exam, January February.
Fab, yes, sir.
Okay, when is your exam, doctor?
It is on 12th.
And okay, that's 12th. All the best, doctor.
Thank you, sir. Thank you.
Thank you. Okay, Dr.
Dr.
Vasia.
Imran,
Yes,
Dr. Imran,
doctor.
just want to ask, failure to thrive, is there any case? Because I have little difficulty to understand this case, like growth chart
Doctor,
especially.
Doctor, failure to thrive. I have two, three scenarios are there. There will
Okay,
be two or three
okay.
things will be there.
Because the
I
chart,
think
little
one,
bit reading of chart, maybe three, 1 percentile, two
doctor,
percentile.
hardly come with the chart. Okay, mother will bring the
Oh,
chart, but
okay.
most of the time based on the history. Okay, now
Hmm.
Sir,
there
really,
is one.
with
Then
chart
sometimes
reading,
the
it's
failure
really
to thrive,
difficult for
sometimes
us, sir.
constitutional delay. So little bit difference, how to differentiate, how to diagnose. Little bit I was
Doctor,
getting confused
doctor, give me 1 minute if I am able to get the chart because I have this thing with me. If
because
I'm getting
even I
the
saw the charts, but little difficulty to understand.
okay, one thing let me tell you, if growth is through and through is lower than his or her that chart like say below the normal belt limits, it will be familiar. Okay, it will what will happen? So child was growing.
Hmm.
Okay, but like say same like father was of this when he was of 12 years old, he was also having the same height and suddenly he increased the height.
Hmm.
Okay. Then second thing is constitutional. Constitutional in that when the child was growing very well, but slowly he reduced his height as per his normal pattern, and suddenly again he gain his height. Okay.
Hmm.
That is a constitutional. You will be getting either familiar or constitutional. Both will be there.
Okay. And failure to thrive means short stature. There is some problem.
There's a problem. That through and through he's having the problem. He is not gaining anything, but he through and through he's getting the problem.
Hmm.
Okay.
And then the doctor, we have to do this father height plus mother height. This formula we have to remember and calculate over there.
No, 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 no. It is nothing such thing. That my difficult case will not come, doctor.
Okay. Okay. Thank you.
Don't worry about Dr. Saira. Not that much. This is not a level of that some different difficult exam. So I still remember that sentence of Dr. Hemant. He used to say in the orientation program, doctor, first of all, you have to understand this exam for the GPs, okay? And for those GPs, maybe some having 18 years, 20 years, 20-year practice, and some having 5-year practice. Okay, they are far away from their books. They are in the practice now. So we are not going to assess them from the bookish knowledge. At that level, they should get struggle. This is a 10-minute scenario. In the 10-minute scenario, we will be taking your superficial knowledge, how you aligned in your superficial knowledge, not more than that. Okay, so this is nothing to worry about this one. Okay, so doctor, I think was talking about Dr. Vasia, Dr. Vasia. Dr. Vasia, are you there?
Hello, जी sir.
Hey, doctor, are you giving exam this in April or in February?
Uh, yes sir. No, no, Fab in 14 Fab.
So you ready to do the case?
Okay sir. I'll try.
Okay, all the best. I think doctor came back
Okay.
and she have to give
Yes.
you the case. Dr. Saira, I'll be getting few outlines, management outline and constitutional delay and familial and failure to thrive.
Yes, doctor,
I'll be
please
giving
share.
I will be giving you adjustments, okay? So it will be easy for you to understand, okay?
Thank you. Thank
So
you,
okay,
doctor.
by meantime, doctor is doing this case, so I'll be Dr. Vasi is doing the case. So I'll be taking care of this one. Okay, doctor, so you can give the timeline.
Yes, Dr. Case.
Oh, I have sent you already.
Okay.
Check it. Is
Uh,
that one case? No, no, it is not. No, no.
no,
Let me
it's
give.
done. It's done.
It's done. Okay, okay. Dr. Saira, you are ready to do the case for failure to thrive because you are eager to know about it.
Oh, okay. It looks difficult for me.
Mhm.
Okay. I
For
was
you,
No,
nothing
I,
is difficult, Dr. Saira. We have seen.
Dr.
no,
Saira, Dr. Saira,
no, Dr.
mashallah, you're
Musarraf.
having good
Last days
approach.
I feel like everything I forgot.
Doctor, we are so blank.
Yeah, everyone is seeing.
Everyone is blank. Doctor Sarah, let me tell you, we were blank through and through. And you won't believe that we were there on the last day, one day before exam. We haven't seen the sunlight from 8 a.m. morning till night 10 p.m. We were just doing the cases, practicing the
How
examination.
many days, doctor? How many days? This all?
7 days,
More than
doctor.
12 hours? 7
7
days.
days.
Oh
Yes,
my
seven
God.
days. And we were in the one. We haven't seen the sunlight, doctor.
For doctor,
That
as a
much.
female, is difficult for us. We wish we can get the time like this.
No, doctor. With me, we have was four doctors. Me and Doctor Sairesh, Doctor Amin, and Doctor Dania was there. So we were four. And heads off to them. Really, just like say we just break for prayer and break for food. Only 10 minutes, 15 minutes, and after it start again. So
Oh,
it's nothing, doctor, and you guys are doing very well. So that is the reason I we have brought up this format that 5 days, 5 mocks, at least 5 cases mock you should go through. At least you should have some practice. You should have nerves. It is not easy to practice doctor in front of 35 doctors to perform the case. Not easy. It's really running onto nerves. Actually, this is not a simple thing. I really hats off to you. Those are practicing and talking in front of the 30, 25 doctors. Believe me, this will pay off when you see that in the real exam scenario, you and your patient and the examiner, you won't feel that you are doing exam. The reason because you pass through the toughest area where you face 35 doctors in a row. They are just looking at your word to word things and word to word situation. Okay, so what happened? They will be keep on asking you the things. Okay, so doctor, continue from the scenario. So I'll be seeing. Thank you.
okay.
Okay,
Thank you.
doctor.
Okay, doctor, please continue.
So,
By meantime, I will be making that failure to thrive and other things. Okay, thank you.
okay. So, mother of 2-year-old Master Hamad. Master Hamad came to discuss his condition with you. Okay, and take proper history, management plan, no examination required.
Okay.
And 1 sec, I'll start the timer.
Okay.
Your time starts now.
Hello, my name is Dr. Vasya. May I know your name, please?
Yes, I'm Mrs. Hadia, doctor.
Mrs. Hadia, how can I help you?
Doctor, I'm just so worried about my son.
Mm-hmm. Tell me.
Doctor, he's 2 years and he's not walking yet, and his legs seems very stiff.
Mm-hmm. Tell me more.
Doctor, he was born before the expected date, and then for a month he spent in the neonatal unit. And since then, I feel like he's not coping up like the other kids.
Mm-hmm.
And now he's 2 years and not walking. I don't know what's wrong with him.
Yeah, I can understand. It must be difficult for you. Can I ask you some few questions?
You sure, doctor?
Yeah. How is the Hadis doing? Is he on the mark of the development?
I don't think so, doctor, because he sat up quite late. Like around
Mm-hmm.
2 months, he started sitting. And
Okay.
now it's 2 years. He's just trying to pull to stand, and he's not like he doesn't walk alone.
Okay. And how is his appetite?
He's eating well, but
Mm-hmm.
it's difficult to feed him.
Okay. And do you only feel changings in his legs or in anything else?
Doctor, when he gets up and we hold him, so his
Mm-hmm.
legs cross each other, and then he start to walk on toes.
Okay, but he stand properly without support?
No, doctor, very he has to hold someone.
Okay. And how is he's getting the things? Is he grabbing the things on his own?
Doctor, he can play with the toys and he can feed himself. I think his arms are better, but his legs are not.
Okay. So you only notice the changings in his legs and
Yes, doctor.
difficulty to get up and walk. Is it right?
Yes, that's all.
Okay. So is he is your first child?
No, doctor, he's my second.
Is he your first child?
No, doctor, he's second child.
Okay. And how was his birth? Did you
It
have
was
any
a
complications?
no, doctor, but it was preterm. He was on 30th week,
Yeah. So he
and
was
he was
hospitalized at that time?
yeah. Yes, doctor, he was.
Okay. So how was I'm so sorry. How was his immunization? Is his vaccinations? Is his completed?
Yes, doctor, it's well going on.
And I'm so sorry.
It's okay.
Um.
And doctor, I feel like something is wrong with his legs only. And
Mhm,
somewhere I was reading on the internet, they said something like
mhm,
um problem with his brain. They said some
mhm,
cerebral thing.
mhm. So how was your health? Do you have any medical illness?
No, doctor, I am yeah, sorry, I have high blood pressure and I'm taking medicines for it.
Okay. So which medicine you are taking?
Calcium channel blocker, doctor, amlodipine.
Okay. Um. I'm so sorry. I can't continue.
It's okay. I'm you can ask me profession. I'm doing uh,
Okay.
yeah, I work as a IT worker, so I cannot spend a lot of time. I have put maid to take care of
Mm-hmm.
him.
Mm-hmm.
His father is mostly outside, so
Mm.
that's all.
So
He's 2 years.
so you are having difficulty to grow up your child. You are
Yes,
having no
doctor.
support at home.
Yeah, right now we have maid, but she's also telling me it's not working. It's been 2 years. Maybe
Mm-hmm.
it's some brain tumor, brain problem.
Okay. Have you seen any doctor before coming to me?
No, doctor.
Okay. Have you done any investigation for it?
No, doctor.
Okay. Can I ask you some personal question if you don't mind?
Sure, doctor.
Do you smoke?
Sometimes, but not at home in front of him.
Okay. Do you take alcohol?
No, doctor.
Okay. Any recreational drugs?
No, doctor.
Okay. So, how is your condition at home?
I'm fine. I'm doing well. Just a bit worried about him now.
Mm-hmm. Um, so what do you think about his condition? What is your understanding?
Yes, doctor. I feel like maybe he's having cerebral something.
Mm-hmm. Okay. So what is your main concern?
Doctor, will he ever be able to walk?
Um, I'll just let you know about his condition. Is
Mm,
there anything specifically you want to know from me?
Yes, doctor. Is it normal that he's 2 years and not walking and this crisscross of leg? Is it normal for the kids? Even though
Uh,
I'm feeding him proper, like I'm giving him formula milk also, and I breastfeed him also, but I feel like,
mhm.
is it normal thing or something wrong?
Yeah, just I'd let you know. Is you just to sum up that you told me that you are having a kid who's 2 years old, and you were just facing that he's having difficulty in walking, and he's having a cross legs. Otherwise, he's feeding well, and he's marked to his development. Is it all, or you want to add something else?
Yes, doctor, it's all. His arms are better, but legs not so. That's
Okay.
all.
From all the information you just told me, and I just asked you, is the condition you are? It seems like that he's having some difficulty in his brain. Um, that's why he's facing difficulty in walking, which we
Yes,
called a
doctor.
cerebral palsy. Do you know about this condition? Have you heard about it?
No, doctor, I was in reading on internet, maybe this same condition. It is very bad.
Mhm. Yes, it's kind of like whenever you just told me that it's a preterm delivery, and there is a
Mm.
difficulty in his delivery. So the connection between the brain and the body sometimes will not that much coordinated. So in his case, he's not having a well connection of his brain with his legs and other developments. So, for that reason, I might suggest you to take some opinion from the pediatrician, the brain specialist. So he will
Mm.
do some test and confirm the
Mm.
diagnosis. Is it okay with you?
Yes, doctor. But doctor, what about like will they put on some medicine or any exercise? I want my baby to walk.
uh, it's being a difficult thing for you as a parent. I can completely understand, um, but we can make things better by giving him a support and and physiotherapy, and some medications like the supplements for the calcium and the vitamin D, and
Mm-hmm.
some iron supplements, so it will help his immune system and his growth as well. Do you get it?
Yes, doctor. Will it ever
Yeah.
go away? Will my kid can live like normal people?
Like, we are just right now we are not in that situation to confirm the diagnosis, but if see this diagnosis will come out, so yes, it is a difficult thing, but there is some organization and some support groups available. So I will connect you with them, so they might help you and guide you how you can deal with your child and make his life and your condition better. So it is not like he will get a better walk, but with the help of physiotherapy and the support, yes, we can manage him to walk better from this condition right now.
Okay, doctor.
Okay. So
Mm.
there are some organizations which helps you in this, and some supports group like other mothers who are having the kids like that. So they will
Mm.
share you the same situations in which you are. Uh, so it might be makes something better for you.
Mhm.
So you will it will help to cope up with your kids' situation.
Okay, doctor.
Okay. Do you have any other questions? Any other
No,
concerns? Which
doctor.
can I help you?
No, doctor. Thank you. Time's up.
Okay.
Dr. Vasia, this was your
Okay.
first case?
Yeah, this is my first case, and the
Okay.
situation at home is not that much controllable. That's why I'm
Dr.
just
Vasu,
get a little bit
well done,
confused.
doctor.
Yeah.
Your more structured approach and data gathering was good. And even though
Okay.
you're thoroughly engaging the patient, sorry, mother, that is actually the part which we need in the exam. No matter what you talk, but it should be in a way, it is sensual way. I know
Okay.
we will not be able to cover the 100%. We will not be able to do the thing, but at least we are able to cover main things. It is a main
Mm-hmm.
issue, a main thing. We call it, the accurate approach. And
Mm-hmm.
approach most of the time it need focused on the patient, focused
Okay.
history, what we call it,
Mm-hmm.
and you're thoroughly engaging the parent. That is important part. Second part, what you call it, we call it, taking each and every step with the patient's mother or parents, concerns. Okay, so
Okay.
it's not something that okay, I'm going to tell you this thing, go and do it. No, it's not like this,
Mm-hmm.
doctor. There is
Mm-hmm.
something we call it, appropriate approach to cover the thing that's what we need, and that within 10 minutes. That is important part. Okay,
Mm-hmm.
doctor. So far, so we covered the 10 or 11 scenarios. So I have to rush
Mm-hmm.
to some other things now. So we will be closing now. And
Okay.
remaining, I think, five topics are there with me. So I will try to cover by tomorrow, anytime. But tomorrow I
Okay.
will be having one session only in the night. I don't have any session in the afternoon. So in between, if I'm getting or Dr. Amir is getting time, so he will be doing. But Dr. Saira, I'll be sharing this topic, sorry, this growth chart with you. So
Yes,
just
doctor.
go ahead with that one, okay, doctor?
Okay,
Okay.
today
Thank you
night,
so
Dr.
much,
doctor?
Imran,
sir.
Dr.
Today
Imran, if you
night, no,
can
there is
please
no
share
session,
this.
doctor, from my side.
Okay.
Okay. Dr. Imran, if you can please share this in the group so that we can also see
Which one,
Yes,
doctor?
doctor.
the group, the growth chart
Yeah,
that you're
definitely. I'm
talking
sharing
about.
for everyone, doctor, not for Dr. Saira only.
Okay.
It is for everyone,
Okay.
doctor. Yeah.
Okay.
Because
Thank
I
you so
just
much.
know she mentioned that's the reason I just point out her. Otherwise, I'm going to share for
Okay.
everyone, doctor.
Thank you so much.
Okay, thank you, doctor.
Thank you, doctors.
Thank
Thank
you,
you so
doctor. Thank
much.
you.
Thank
Thank
you.
you,
Thank you.
Dr. Amran.
Yes, doctor. Dr. Mona, all the best for your
Thank you.
apparel.
Thank you, doctor.
Okay.
Thank you so
Thank you,
much.
doctor. Thank you, doctor. Bye bye. I'll be sharing the recording also. Thank you.
Thank you.